מחר אני הולכת לפסיכותרפיה, כן.
אז כאילו פעם שנייה
כן, זה יכול להיות מאוד נחמד, הם בטח מתכנסים בימי שישי כשהם לא עובדים.
כן.
כן, בסדר.
יופי, אני שמחה שזה
כן, קרם עור וגידים, כן. אם כמובן יהיה ביום אחר, אני מיד אגיד לך. אבל זה נחמד. פלא שדני לא מתלבט על זה, פגע.
pigmentation and anti-aging. So, you know about the formation of papules and fistulas, and the question is, where can we cut this or sever this chain of events? Hyperkeratosis with black heads, white heads, papules, pustules, and all the way leading to scarring. Now, hold on. This no, we're not going to start asking questions now. That will come later. Okay, so hyperkeratosis, obviously, that's when comedones start because the follicle is being obstructed, and that's where we have to start working. The comedones is our work, and the papules, which is an inflammatory state, but not PASI, that is something that we can start treating. The problem is with the pustules where you already have pus, and that's already infected. So sometimes I would be very happy to get some help from a doctor, because once we have an infectious situation, we have to think very carefully what we do. The cysts, actually, that's a point where I do want to start treating it. That's more problematic than the pustules, because we have to, and pigmentation we can prevent. We have to explain to the patient that you shouldn't fiddle with it, but there are two things that we must bear in mind. Once the cosmetician sees the first scar, and you can see it somewhere on the side of the face, take your patient and just send her to a doctor straight away. Don't be embarrassed about it, because once there's scarring, lose no time. Once the skin starts scarring, the medical treatment, and I think Roaccutane is a gift, a real gift to all young people who could suffer from acne. Otherwise, if they can, take it in order to prevent the scarring, because it can be prevented, but once the scars are there, it's much more difficult to deal with. Of course, a little bit of peeling and retinols and all kinds of things, yes, but here you must do everything just a minute before. And don't say to the patients, oh, don't go to a doctor because it will work out. No, a scar is the first indication, not the number of pimples or their severity. It's less important than the scar. The scar is the first place. The second place is a question of how long has this been going on, even if it's not so severe, without any improvement. These are two indications that should turn on a red light for us, sound the alarm, if it's been going on for a long time and if she's beginning to scar. So now look, I've pulled out several photos and I said, okay, let me just talk about these. Just a few. Here we can see. What is the problem with this skin?
Проблема этой кожи. Вы видите, что
She has closed comedones,
комедоны закрыты,
it's actually
микроцистоз.
microcysts. So what is the problem? The skin is very dehydrated. You can see it in the picture. Very dehydrated. There are two things that she needs. Before peeling, first of all, give her a little bit of retinol with glycolic acid to peel the skin away a little bit, open it up, and then all the draining and the flexibility of the skin will be different. This a little bit of moisture, it's like a shoe sole, it's all closed, nothing comes in, nothing comes out. You have to release it a little bit and then start with the treatment. Don't start with the peeling, prepare the skin first, and afterwards. And here I am showing two cases is an older man, about 78 years of age. Look at the very thick skin. And we were just talking this morning with Oli. Quite a few women at a later stage in life, even very late in life, come to us, and it's called comedogenic acne, even if they never had any before. Never had any acne at some stage in their life as a result of sebaceous gland being obstructed, start getting all glycolic acid, retinol, all kinds of peelings. All these are a real gift for us, because otherwise you just can't deal with it. How much can you go cleaning it? The skin is already sensitive and the blood vessels are sensitive. How much can you squeeze it? And this is something that can happen even in women of a much older age. Decades ago, when I used to work for the Nina Bella sisters, I don't think anyone here who still remembers. It used to be one of the greatest, most famous salons. We used to treat pigmentation with mercury containing agents, and there were also hair dyes that contained mercury, and you get loads and loads of black spots on your face. And I remember all those black things. At the time, if we had retinol, so much of the hard work would have been saved. So even at a later stage in life, in this sort of case, she would get a little bit of glycol, a little bit of retinol. Her skin will start looking better thanks to the anti-aging properties, and the comedones would get better as well. And you do what you need to clean it.
Okay. Okay, here I've got something which is really a wonderful picture. Yes, this is a woman, 40-ish. You can see, just look at what she's got. She's got fatty and thick skin. She's got open comedones, closed comedones, a little bit of papulas. She's got acne scars. She's got hyper and hypo pigmentation. In some cases, instead of hyper pigmentation, you get wounds that eating it, this microbe. What do we mean by this eating, quote unquote, the creation of inflammation? How does an inflammation take place? Because this microbe secretes different substances that Tori, and I'll get into some details. So as I've said, acne is actually a problem in the sebum, the pilosebaceous unit. It is connected to the follicle of the hairs. The main causes overkeratinization of the follicle, and they are barriers to the secretion, and an increased secretion of sebum that can't find its way out, and the proliferation of microbes and creation of an inflammation. What do we have in the oversecretion? There is a traffic jam, so to speak. The sebum doesn't get out, and it creates the comedones. This is a sebum that can't be released. We have two types of comedones that I'm sure you know about, because this is your most active part, the white one and the black one. The difference between them is the openness towards the environment. A closed comedone is a white one. A black one is a comedone, the ceiling of which has been opened, and there's oxygenation of the sebum, and that's why it becomes black. Somebody said something, but I couldn't hear it without a mic. And the lecturer says, you're right. As we've said, these comedones are a very good outlet for the P. acne to proliferate. So it increases and proliferates, since it has this, and it induces an inflammatory process. We've got here a scheme that shows very nicely. You can see here, one is a normal skin, the very basic structure of the skin. You can see here the hair follicle. Here you see here the follicle and the sebum glands that connect to each other and flow, so to speak, into this space of the follicle. What you can see here is that the sebum here is increased too much, and it can't be secreted, and you've got here this plug. When the plug is closed, when the keratin covers it on the surface, it's closed, so it looks white. And when it's being torn in the upper part, and it happens because we wash our face or we touch it and we scratch it, there's contact with the air and it becomes black. A very important point is that the definition of the severity of the acne dictates for us a lot of things to be done later on. We've said that the lesions that are not inflammatory, and these are the comedones. This is a stage that is almost exclusive to, and I couldn't hear what he said, with different, if we, and this is where you should do. You have papulas as well. These are red pockets, what's called pustules. This is the stage in which you make the preparation, and the dermatologist is going to give the treatment, and this is the whole process at this stage. Of course, the deep inflammatory lesions, cysts and nodules that are created by a deep inflammatory process that creates the worst things in acne, and this is the scarring. And the severity of the acne. comedone, some of them white. You are never going to see a monomorphic disorder. You'll have a variety of phenomena all over the skin of the patient, and you see here a small fistula or fistule above the eyebrow. Here you see a more severe zits. I say the word zit because I'm using the popular name for it, for these wounds, zits, pustules, papulae, and this situation really needs treatment. And the deepest process, if we feel it, we will feel lumps underneath the skin, and that creates scars after it, because that's a profound, a deep inflammatory process. And some ideas about the etiology. 50% of the population goes over this or that degree of acne. This is an astronomical numbers in the Western world. 90%, sorry, not 50, as I said before, 90% of the Western world and feel it, and in the Western world, 90% of adolescents undergo acne.
The average for girls, 14, 17. I'll soon qualify that. With boys, 16 to 19. That's the peak of the condition when you take the statistically, and we are narrowing this down more and more. Do you know why? I mean, why are the age groups becoming younger and younger? Well, that's one reason. Yeah, hormones, medications. Why else? The genetic element doesn't change much. It's mainly the hormonal element in it. You're right. The hormones that we find in the engineered food that we consume, milk for example, is not so much milk, it's mainly hormones, because the cows just are given so many hormones so that they will increase their milk production, and that's why you see very young girls with budding breasts and 11-year-olds with a mustache, and children become very young adolescents, and acne comes with it, because there's hormonal maturation and acne starts flourishing. There's no difference between boys and girls. It's just an urban legend that boys have it more than girls. There's no statistical correlation which says that sex is one is more prone than the other. It is true that more severe cases of acne and more scarring types of acne are found in boys, and here there's another element that I would like to introduce. In certain types of black skins in the Western world, Afro-Americans, there is more severe acne than in the average. And as I've said, there's an average of age groups, but acne can appear for the first time at the age of 30 or 40, or continue all the way from one's teens to the 30s and 40s. Do you know why could that happen? Well, once again, those hormones. That's right. Pregnancies, all kinds of treatments. Every third woman today undergoes fertilization treatments, all that Pergonal and all this does have an impact on our hormonal composition. And another thing that we must take into account because it has bearing on what you do. Right. Thank you. Do you have have any idea why you might see some acne at the 30s and 40s? Any other ideas? Stress, that's right. Yep, definitely has an impact. What else? Something that has to do with you specifically. Hormones, we've already said. Cosmetics, ladies and gentlemen. It's not just those who get oil acne because they deal with the oils and fuels. Cosmetic acne, that's one of the classical reasons for acne in later ages. Yes, definitely, later age groups. It has a very particular shape. Oh, and of course there are also babies with acne because they are breastfed, and that's because of the hormones. It goes away. It doesn't need to be treated at all. Sometimes they have some on their cheeks, but it goes away. You see, you know everything. I'll give you an exam afterwards. Let's see how well you do there. A little bit about myths. You know, people have all kinds of myths. What are the classical ones? That chocolate, chips, sex, beer yeast, all kinds of things induce acne. We'll soon see which one of them are actually true. What are the real exacerbating factors? Androgenic hormones. Testosterone is the representative of the male hormones, but there are others, VIGAS, progesterone, and others. They can definitely contribute because androgenic hormones result in hypersecretion of sebum, and once you have that, that's acne in potential. Contraceptive pills, which are not taken against acne when they have a progestative element, could cause acne. And also, counter to what many gynecologists think, intrauterine devices, Mirena for example, cause acne, and we have been arguing over this with gynecologists, but my experience was that, you know, I asked a woman to change her intrauterine device into a non-hormonal one, just a physical one, and her acne disappeared. There are some psychiatric medications that also cause acne, lithium for example, and thyroid less. Oh, thyroidism less so. The kind of occupation a person has, if they're in an environment of oils, fuels, halogens, bromide, there's occupational acne. High temperature and they don't actually cause acne, but they do exacerbate acne. Going back to the myths. So let's put things straight. Sex, having a lot of it or too little of it, does it have anything to do with acne? No, obviously not. Nothing. Beer yeasts, does that help acne? It used to be given as treatment decades ago. No, not at all. Obesity and diabetes, what about that? Well, unlike what people used to think, apparently yes, and I'll give you two examples. There's something called PCO, cystic ovary syndrome. There is when there's overweight, they tend to develop acne, and afterwards also hypertension and diabetes if it's not treated. As for diabetes, not directly, doesn't exacerbate it directly, but today we know for certain that high levels of sugar do have an impact, or actually every food with a high glycemic value. carbohydrates such as white sugar, because there's a certain axis that goes via insulin. You know that the body reacts to sugar is through injecting insulin into the body, and that causes exacerbation of acne. So that's why when you asked whether some diet is necessary, then yes, we have talked about industrialized food, about milk, so reducing fatty dairy products, and especially milk, so not cheeses so much, but milk, and also cut down on sugar. So sugar is the main culprit, and there was a question here that the interpreters couldn't hear. I'm sorry. What about cleanliness? That's one of the myths. Lack of hygiene. Does that cause acne? Well, the answer is no. The answer is just no. It is an assisting factor, an exacerbating factor. It's not unless you have an inflammatory. זה לא רק אנחנו, אוקיי. זה מקטע אצל כולם. לא, אבל זה לא עובד, לא עזר להם. משהו. לא. No. I hope the microphone is all right now, he says. Well, it's not all right, actually. There's something wrong with his microphone there. It's sounding like the waves of the sea. Exacerbated. So when a person is not clean, not hygienic, that in itself is not a recipe for acne. But when you have inflammatory acne, then hygiene is important. So we have to be clear on that one. Okay, this we have covered already. So when you get to the doctor, what happens? The first thing you must ask is, how long have you had these pimples? Why is that important? Is there any importance? Is it important how long the inflammation has been going on for? Of course, because the longer it's been going on, the secondary damage is worse. So it has to be treated as early as possible, as soon as possible. More a matter of an aesthetic thing, and sometimes the child doesn't want to go and it doesn't have the time, but then afterwards that results in emotional scarring. I mean, you know, children have started managing their parents in recent years, and I've been seeing some cases in my waiting room. Wow, horrific. Now our dilemma is, talk to us is, what do we do? Do we start firing all the heavy guns right away, start something else, do some localized treatment, or say just see a cosmetician and you're fine? How do we choose? So let's start with local treatment of acne. sulfates, and you can't use them. So, local acne therapy. Are soaps useful for acne? The answer is right, yes and no. The answer is right. Overuse of detergents will exacerbate acne and will also result in all kinds of adverse effects such as dryness and irritations and sensitivities, and therefore everything has to be done carefully, and it's not every kind of soap is suitable for your face or for someone else's face. Not every detergent is right. You have to have the right detergent. Strong is not necessarily good, and it should be right for the person's face and for the acne. Too much washing will give a bad result eventually. The salicyl spirit that every girl 30 or 40 years ago used to use is fantastic. It's great for opening comedones, 2% max. No need for more than that. On the face, I would be careful. On the back, on the chest, very good. Salicylic acid. What about sulfuric agents? They work very well, and you can get them off the shelf. It's anti-inflammatory and chemolytic. The benzoyl peroxide. It is chemolytic and antibacterial, and you can get it just by itself or combined with antibiotics. That's the most popular and best treatment for mild cases of acne. Retinoid acids, Retin A, and others. In Israel, there's only one kind of that. Unfortunately, that's Retavit, which contains retinoic acid, anti-inflammatory, antibacterial, chemolytic, very efficient. There are two concentrations, 0025 and 005. There's another derivative of vitamin A, which is called Daferin. Causes less irritation of the skin and has a similar effect, even though it's less aggressive. We must note, however, that using retinoic acid is for the winter time, because there's very high sensitivity to sunlight. The patients must be warned not to use it during the summertime, unless and if they do so, use very high and efficient sunscreen. I will not talk about the azelaic acid because it has already been discussed. Very good agent, very good preparation at 20% concentration. For some reason, it's not used so much in Israel. It's comedogenic, chemolytic, and also lightens the skin against pigmentation. Local antibiotics. Usually, there are two kinds. That's erythromycin and talisin. These are the two antibiotics available. The retinoids, as I have said, anti-inflammatory against the comedones and antibacterial. Locacid is already out, it's very good. Retavit, Daferin, antibiotic agents, erythromycin and based, and there are combinations of those with other preparations such as Thinaclean peroxide preparations, the external topical agents which are comedolytic. They melt away comedones and they are used against bacteria, but they can stain clothes. Benzoyl peroxide is an oxidizer, and you mustn't come in touch with any clothes because it leaves white marks. Azelaic acid skinnoderm is useful as long as used for a long period of time. That's why it's not used so much in Israel, because people here want to just get it over with and see results right away. We have mentioned sulfur and other. There's only very few doctors who make their own preparations, but they're hardly ever used because there are very good products to buy off the shelf. Now, what about systemic treatment of acne? There are all kinds of antibiotics. Is it going to help for comedones? No. When do you use them then? Once we have an inflammatory process, and once the P. acne bacterium starts spreading, we want to reduce the number of colonies and the size of them. We want to use something which is both antibacterial and anti-inflammatory. So the first and main agent to use is called minocycline. It's from the family of tetracyclines, and it has two main features. It kills bacteria, but it also has an anti-inflammatory effect. And when you speak of inflammation and bacteria, it's not necessarily on the same plane. Around the bacteria there is an immunological process that takes place. The inflammation is an immunological response to the bacteria. So in order to reduce that response, we need anti-inflammatory ingredients, and this medication has both. It has a cousin called doxylin, which is less efficient, I think, but is still used quite a lot. The erythromycin, for those who are sensitive to minocycline or tetracyclines in general, and there are such sensitivities which are manifested in headaches and dizziness, and that's not good, because it actually means that your intracranial pressure goes up, and that's not good, of course. So the alternative would be erythromycin or other macrolides, which is the same family. That's less common. Usually when the tetracycline antibiotic fails, the minocycline or doxylin, usually we try to think further ahead rather than try another one. In certain periods of time, some doctors would use Resprim sulfur, because there were many sensitivities and adverse effects. Those are not used very much anymore. There are hormonal treatments. A very important layer or tier that we can use, but that's only for women. So I'm glad I'm not one. Sometimes we just utilize the fact that a girl might want to take the pill, and then we check her hormonal makeup, and we see what happens there. Does she have perhaps some aberrations? Maybe she has a cystic ovary, or maybe she has high testosterone, or maybe she's just not so regular, and she says, okay, doesn't matter. And then it turns out that she has a cystic ovary, and then pills will regulate her, but also give her better chances for the future, because that can have an impact. So if you have cystic ovary or hyperactivity of androgenic hormones, so we have all kinds of pills that can help, and the type of pill will depend on the type of problem. Sometimes we add anti-androgenic elements to the pills. There's in the Diana pill there is cyproterol acetate, and that's anti-androgenic. And if we add to that something else, then we get a better impact. You can also avoid using pill, but rather use something which is spironolactone or Androcor, and that's actually a diuretic agent. If you use it to a reasonable extent, you can help that. In the United States, since the Diana is not so popular, they use the spironolactone as an anti-androgenic treatment. Okay. And if none of that worked, or the case of our patient is very severe, then we get Roaccutane. Roaccutane in Israel comes by two names, Roaccutane by Roche and Curatane by another company. They have very similar effects. If they ask you what's better, there's none of them is better than the other. Both molecules work very well. And that's a vitamin A derivative. What does vitamin A do? In the past, it used to give huge amounts. Miriam probably remembers when they used to give huge amounts of vitamin A for acne. It's very toxic, highly toxic, but what vitamin A does is four things. It knows how to do four things. It knows how to regulate those peaks in the sebum duct. It's like a plumber. It sort of opens up all those obstructions. It's also antibacterial. It knows how to fight bacteria. It knows how to intervene with the immunological, the immune system, the immunological reaction. So it has some very good things going for it. And they said, let's take this vitamin that has many different effects, and let's see what exactly is the active agent. Now, where does vitamin A come from? From our nutrition. It's one of the groups of nutrients that are part of the DECA vitamins, D, A, K, that need the fatty environment in order to be absorbed in the body. Now, vitamin A, once it enters the body, doesn't stay as vitamin. The body knows how to break it up to its different components. And they found out that one such component inside the vitamin A molecule, which is called the 13C degranoic acid, is the one that helps acne. And it's actually a lot less toxic than vitamin A in itself, and that was the breakthrough. And we've been giving this medication for almost 30 years. I think in Tel HaShomer we were the first to give it about 30 years ago, very, very cautiously, and it's been working very well. Yes, you don't need all the other elements of vitamin A, and this way you reduce its toxicity, the fact that you break it up in this way. There are many adverse effects. You can see the list listed here, and that's just the tip of the iceberg. There are 300 more. There are still, in the population, there's still a lot of many myths about it, and people are afraid of it, and even doctors are afraid of it. I gave a course in, I actually gave a presentation about Roaccutane alone to pediatricians. You should have heard the questions that they asked, and you would have understood how much people are scared of it, and that's just due to ignorance, to not understanding it. Given at the right dosage and with the right control and supervision, it's an excellent medication. Just blood tests and see the patient not once a year or twice a year, every 2 or 3 months, and listen for any adverse effects very carefully. So let's see what really happens with this tablet. So first of all, it's taken on a daily basis, okay? If you weigh 80 kilos, you get 80 grams. If you're 50 kilos, you get 50 grams. And then the adverse effects would be very severe. Nosebleeds, dry lips, because of the dryness that it would create, the dehydration. But over the years, we've learned that there's no need for such a high dosage. But the thing is, instead of giving it for 3 or 4 months, you give it for 6 months. The amplitude will be lower, and the dosage will be lower, and we'll dry it all up, but more slowly. And now, instead of 1 milligram per kilogram, half of that, half of what we used to give before. And soon we're going to go into the anti-aging treatment, and that's a really ridiculous kind of dosage. I know there's a question from the audience. Someone is saying that she knows that it's not allowed to be used in the US. It's not allowed anymore, but he's saying no, that's not correct, and I'll soon relate to that. Now, all you can see here on the screen, they're all other than the ones which have question marks, are things that actually happen once in a while. None of them is irreversible. Everything is reversible, everything is manageable. Dried lips, okay, let's treat that. Dry eyes, so you can have artificial tears. Hair shedding, we'll stop it, we'll stop treatment, or perhaps give or change the dosage. But I can tell you, I've been given this for 31 years, and the number of people who actually go through such difficulties that they have to stop taking it altogether is negligible. A negligible number of people actually stop taking it. When will we stop it? When it causes severe headaches because we're afraid of the intracranial pressure, vision impairment, double vision. Well, pregnancy, you can't give it. You don't give it. No problem with fertility. You mustn't take Roaccutane while you're pregnant, and Roaccutane doesn't prevent you from becoming pregnant. Within 2 months of taking it, you can have twins, you can have triplets, as many as you want. So why are people afraid of it? Taking it during pregnancy, it does cause congenital defects. So you do tests every month in order to test blood lipids and liver functions. That could go wrong, yes, but that's completely reversible. And we don't worry too much about slight rise in liver enzymes. If it's twice or 3 times the normal rate, then we stop it. But a slight rise is is nothing. And let's say if a pregnant woman, no, of course. He's responding to some questions from the audience that we cannot hear. And here comes a very good question, which again we couldn't hear. But the answer is at the beginning of the road, because dosage was different, they only used to give it to those adolescents that had terrible cystic acne. But now it's given already to 13-year-olds, and by the way, you can start using it at the age of 12 or 13, by the time that a child has already finished growing, more or less. And with girls, after they started having their period, that's the lower threshold. As far as the top threshold, I'll soon explain when and where do we use it in the older age groups as well.
That's forbidden. Sorry, I couldn't hear the question. 1 month later, you have to understand that the evacuation of the medication, because it's imbibed with fat. With fat, it's it's in the fatty tissues up to 1 month. Since it's still in the fatty layer in the subcutis, we prefer to wait for 1 month. Significant peeling activities, half a year after it. For example, if you have acne scars and you want to treat them by peeling or radio waves, we have to wait for 6 months at least, not while you take the Roacutan. The preparation for Roacutan, yes, you should prepare the patient as much as you can do, comedones and all the things that you can do, and bring the patient into a better situation in order to start taking the medication. We'll treat a little bit the question marks here, and it has to do with the United States. X years ago, a son of a very influential senator committed suicide when he took Roacutan, and then there was a whole saga with the lobbying, etc. A whole story was made out of it, and then the rumor was born, and I'll explain to you why it's a rumor, that Roacutan induces depression and can make people commit suicide. Okay. They just threw a stone into the well, so you should check it. People checked it in many places. The most serious paper from the European Academy of Dermatology, and since this is a European medication from Switzerland, and they have a big interest to protect it, and they said that there is no proof for any effect of Roacutan on one's mood. But just a minute, just a second. Sorry, I can't hear the questions. Quite often you find yourself vis-a-vis very problematic age, adolescence with all the craziness, and the image of the patient is very low. Sociability is impaired as well, so you never know which is the patient. But what we can do very carefully, we asked the patient, do you take psychiatric treatment? If the answer is no, no problem. I ask the mother, is his mood volatile, yes or no? And if it's a psychiatric patient, I write a letter to the psychiatrist and I ask for his permission. And in most cases, the answer is he's balanced, he can take Roacutan. Yes, most of them. For example, Ritalin and all that, there's no problem. There are no topical treatments. Roacutan is the nurse, is the psychiatrist, is the doctor, is the assistant. It does the whole job. Sometimes we add to it when the inflammatory process, when there's exacerbation quite often at the beginning, and the wounds go out. It's like dwarfs that sit down inside the skin and push the wounds out. So we sometimes add antibiotics, Riomycin, for example, and there's something else that I'm going to elaborate on in a minute. So the bottom line is that in fact there are no proofs, no evidence to this connection with depression or suicidal intentions, but we have to be careful, as I've said. So up to now, even if there are changes in liver functions, there is no irreversible situation to stop or to continue the medication. If the liver enzymes go up moderately, we don't stop, we just follow it up. If it starts to be significant in terms of the multipliers, the values are double or triple, we stop the medication. Up to now, for more than 30 years, there has been no irreversible, no report of an irreversible damage to the liver, unlike, for example, antifungal medications. And I'm talking about side effects. Let's talk about prohibitions. No exposure to the sun, categorically. Pregnancy, alcohol, drinking and a strained physical effort, because there is an over breaking down of the muscle, and then certain levels of protein go up in the blood, and they might create an impairment to the kidney. So that is why that is an indication to limit the usage of this of Rakuten for athletes. Sorry, can't hear the questions. Sorry, can't hear him. I'll answer the question. The question was why people hurry to administer Rakuten for light cases despite the risk. So let's put some order into it. The risk is a very reasonable one according to the accrued experience. We have a huge experience with Rakuten. We're one of the record holders in the world in Rakuten usage, Rakuten administration. Mike, please. Mike, please. Can't hear her. People from Ukraine can't get it there, and in Israel you can. I would like to put some order into things. Would you have wanted to cope with your young patient? Let's say that it's a 15-year-old girl that does not want to go out of home, doesn't meet friends, speaks all the time about her last day in her life, about the last day in her life, that the acne of home is not very severe, but her image is very, very low, and you know that with another medication you're going to treat her for 4 or 5 years without any process or promise of 80% success. 80% is the promise of Rakuten, and even more than that. Maybe this 15-year-old girl has undergone a whole host of treatments that have failed. So the fact is that the situation is worse. Not to choose the best. I would choose the best. Of course, you are doing it more easily because we are sure about this medication. This is the reason why. You're going to the extreme. Sorry, can't hear him. No problem with any cosmetic product that does the job, but you should understand that this is an instant society. Everything should be very quick. Everything is urgent. Everything is cellular phone and internet and computer, and everybody wants to be the American Idol or the Israeli Idol. So you want to give a relatively quick remuneration for these people, and so the easiest cases come to Rakuten. It's usually because other things have not been successful. Usually, I see patients that come to me after other medications have failed, and I see that the situation is not severe, but this patient is stuck, simply stuck. And then I'll administer the appropriate dosage of Rakuten. It's like a cookbook. Different doses for different people. A good cosmetician does whatever she can do, but it's past that stage. I'm talking about the stage in which it hasn't crossed this border. Yes, on a daily basis. In a minute I'll talk about other methods. Rakuten doesn't take care of scars, doesn't treat scars actually. In a minute I'm going to get to what you've asked. Dosages. For your question, the between half a milligram to 1 milligram per kilo of weight. Today, the tendency is to go left, namely towards half a milligram as a full dose, a daily dose with monthly blood tests, despite the fact that in the world they are so used about this medication that they don't go for blood tests every month. Before the administration, 1 month later, and then in intervals of 3 months. In Israel, you go for blood tests all once a month. In other countries, they are so sure that they don't have blood tests so often. There is the low dosage. The low dosage is for easy cases, and we can administer 20 milligrams, one pill of 20 milligrams per day, and if the situation improves we can go down to 3 times a week only, and if it's wonderful you can go down to 2 times a week. It's like a cookbook, really. It's really an art to play, so to speak, with Roacutan. We can do it. There's no automatic dosage. The idea is that you have to have an accrued effect, so maybe the time period is going to be longer. Sometimes I administer even two pills a week. There is rosacea. You've probably heard about it. So in women, in older women. So sometimes I administer that. So it's less of an indication. It's a little bit exaggerated. But for rosacea, the answer is yes. Very true. It's not a function of dosage, it's function of the molecule itself. One molecular in the bloodstream is enough in order to affect the body in terms of side effects. As long as you don't feel muscle pain, and we check it in the CPK, the enzyme that is being produced out of muscles as a measure for the disintegration. I have basketball players who took it, and some people, write down something with their pen and then their back is stuck. 2 more words before I get to the last topic. There are doctors who administer Roacutan in a very low dosage as an anti-aging product. Well, it has these qualities. Retin A works on the outside when we put it on our skin. So if we bring a high concentration of this material to the skin through the bloodstream, of course we're going to have the same effect. But there's a big question mark above it. Nobody knows on a long-term basis what is the meaning of it, and that is why it's not anchored in the professional literature. There are doctors, especially female doctors, and they take it on a constant basis, once a week, twice a week, for years. A low dosage, 10 to 20 milligrams. Again, there are no medical data-based evidence medicine that proves that the safety is good on a long-term basis, but there are those who take it, and it's effective. You can't denigrate that, but you have always to think, I say to my friends, what are the data that you've got? Sorry, can't hear her. Can't hear her. The microphone is not on. Oh, now it's on. I'm talking about very fatty skin, very oily skin. This is one of the indications. Not administering Rakutan to women who have a very porous skin, which secretes a lot of times, and sometimes even zits on the scalp, a very fatty scalp, to give them a low dosage of Rakutan on a long-term basis in order to take this woman out of the cycle. It's not always successful, not on a long-term basis, despite the fact that some of the women can get out of the cycle while they're taking it. Something actually gets to a balance, to an equilibrium. So a low dose of Rakutan can be given to women who have to cope with an oily skin, face skin. And the last point is phototherapy. Phototherapy is a very old a field. It uses light for different treatments, and I'm talking about a wide variety. It's not one lamp with one wavelength. It's a whole industry. The classical phototherapy is for what? For psoriasis, a chronic disease, a terminal disease that we have to cope with all the time. One of the most effective treatments, what the Dead Sea, for example, it's the radiation from the Dead Sea. It was emulated by different lamps in different wavelengths that are very effective against this enhanced cell division that happens in psoriasis, and improves the situation. In due course of time, methods have become more effective, more efficient. The wavelengths have been reduced to safer wavelengths, less risk of skin cancer, but this is still a very popular and effective treatment. Other phototherapy treated diseases that are treated by phototherapy, skin asthma, what's called atopic dermatitis, phototherapy, and itching, and light can improve the situation of different diseases and disorders of the skin. Usually the classical phototherapy is used is using the UV rays, and there are side effects, as you know. UV can create damage to the skin, a higher malignancy prospect, despite the fact that the correct selection of the intensities and wavelengths have diminished those risks, but the risk is still there. Acne, for the older people amongst us, you know that during the 1960s and 70s, beauticians would use a lot the blue lamp. It was good for acne, it was good for furuncles and different inflammatory lesions, and nobody understood why in some of the cases it really worked, but there was this feeling that it hits the place and it does something to the inflammation. And people have been thinking for many years what can use from the visible sun rays that are not dangerous. And it seemed that certain wavelengths can do two things. One is to kill microbes. Certain microbes. A microbe is a living creature, very primitive indeed, but it secretes things as well. It's like every one of us. We go to the loo, and the microbes have a loo as well, so to speak. The secretion of materials doesn't do anything to them, but once they are radiated by a certain wavelength, the blue spectrum, it becomes toxin. It becomes a toxin that kills the microbes or bacteria. It is called porphyrin. The minute you change it to protoporphyrin, it's toxic to the microbe. The microbe secretes and doesn't know whether that I'm going to kill him by this by this lamp. So we have an antimicrobial element, and acne is also, the P. acne also secretes these substances. However, I would like to affect the inflammation as well. Inflammation is not necessarily a contamination, infection, sorry. It's an immunological reaction to the infection. The main issue in acne, well, they found that red skin, for example, in a certain red light in a certain wavelength can reduce the intensity of the inflammation. They took those two elements, put them together in one lamp or in a group of lamps, LED lamps, and with an alternate operation of these two wavelengths, the red and the blue, it was found that the acne has been decreased. And I've been working with it for a number of years. Usually those devices come from the United States. It's a wonderful method for people who don't get systemic treatments or by os, per os, sorry, for example, athletes that can't take it. I give them a combination of this treatment with creams, external creams, and the effect is very good. It's not an eternal solution, but it works at least as well as antibiotics, and that's the advantage. I quite often skip antibiotics administration, and I give them this treatment without administering antibiotics. Usually it's 15 treatments, so if we talk about twice a week, this is the sequence. It takes about 3.5 or 4 months. I've got wonderful results. I can show them to you from some of the people, but the question to be asked is it sold in the super farm? Yes, it's those appliances are sold in the different IPLs. It's not the same intensity. It's a waste of time. Sorry, it's a waste of money, he said. It's a waste of money. It's not the same intensity of the light as the professional devices. Okay, he said, but we haven't heard the comment. But again, this is, I know what IPL is. I was involved in it for years. IPL is flashes of light, a sequence of other wavelengths, and it's not the same intensity. It doesn't heat it. It's continuous. It's not flash-based. It's continuous, what I'm speaking about, continuous light. It's not on the same level. It's something totally different. So the advantages of phototherapy, since some of the people have these exacerbations after using Roacutan, and it doesn't prevent it. 35% have an exacerbation of the acne. If you want to prevent it, you should go for phototherapy. Phototherapy in such visible light wavelengths is not problematic at all. It's not dangerous at all. Of course, there are athletes and people that have objective reasons why not to use this but use phototherapy. This is the device I've been using. This is the situation before. Here I took examples without Roacutan, benzoyl peroxide and dafarin. This is the result after 3 months. These are my patients. This is why they agreed to be photographed. The average is 15. I sometimes go over to 20, but this is based on my agreement with the patients before and after, to take a picture before and after. Usually around 30 minutes. I do it on both sides. Yes, with music, MP3, and it's not harassing, it's not a lighting that is unbearable. This is before and this is after. After all, those poor kids who are so depressed that don't want anything and that everybody's doom is gloomy for them. The father and mother try to caress their ego. The whole family is around the problem of acne. We want to turn them into such youngsters. A word about scarring. This is a chapter unto itself for another lecture, but just let me say that the solution for scars is a mechanical one. A scar is actually fibers that were created in the profoundness of the skin, fibrosis towards the bottom, and you have to flatten the place. They don't disappear completely. We have to take everything in proportion. We said before that the longer the inflammation until the treatment, the deeper the lesion, the bigger would the scar be. Do it as early as possible and don't be afraid of aggressiveness, because otherwise it's going to last longer. Unequivocally, yes. We didn't hear the question again. The question was that if during phototherapy you can take cosmetic treatments. Yes, of course, but Roacutan, if it treats this and that. By the way, phototherapy enables me to give them a lower dose of Roacutan, so there is less drying. For example, I can give 20 or 30 milligram, because phototherapy gives another remuneration like antibiotics. So I combine two things. The answer is no. Cysts is the only thing that can do the job is to open the cyst in one way or another, and we inject steroids into the cysts or through the Roacutan that can do some of the job and not always. No problem. Why not? But it doesn't have to do. Sorry, I couldn't get the question. I don't know what they're talking about. There is another question from the chat. I don't know. It's Septo. It's a commercial name of something. I don't know it. Older people quite often, usually near the eyes, near the orbits, have big black comedones. It's called Favre-Raccouchot. It's a French name. It's a phenomenon that comes from exposure to sunlight. It's a damage caused by sunlight. The only thing is to clean it. It's your line of work. Yes, it's inclusion cysts that are caused by the sunlight. In principle, Roacutan is not for anti-aging according to the medical indications, but there are some doctors that give it instead of retin A to put on the face. They administer Roacutan. Tin-A, it's not on its own. It's mixed with other substances. People have mentioned kojic acid, glycolic acid and inoquinone. There are those mixtures, different formulae in order to fight pigmentation and other phenomena. But again, it's a chapter on its own, and I don't want to get deeper into it because each question of this sort deserves a lecture of 1 hour at least. Not before the first period, the onset of Rakuten administration, not before the first period with girls. Usually it's not recommended unless it's something really exceptional, and not before the age of 12, even with boys, because we want them to tap the potential of getting taller and bigger. Yes, but after 8 years of acne, they've already been damaged. They can come today at 4 o'clock to my clinic. Roacutan is wonderful for acne, of course. Usually it's a cystic acne on the back, on the chest, on the thank you very much for your attention, girls, he said. Now I have to drink a cup of water. Sorry, can't hear.
shame some of the girls have already left because now we're going into the cosmetic treatment. But it's their loss. That's a shame. Someone from the audience is saying, I think I'm going to be talking on behalf of all those present. This company really makes us feel so much at home. For so many years, for 30 years, Christina has been developing with so many interesting things, and the prices are so reasonable that sometimes it sounds as if it's too cheap, you know. And the way they have hosted us here, I mean, I really want to thank you. I really want to thank you. Thank you so very much. I'm just saying that thank God we've been in existence for the past 32 years, and we are really privileged to have such a beautiful factory and beautiful laboratories and have such a nice room. This is all new, and if you come to a place like this, enjoy it. You know, if you get to a place like this, enjoy it, and give to others of what you have. And we're open to cosmeticians with free of charge. You know, we do these. We're going to do some more seminar days on all kinds of topics, either anti-aging or other things which I think you'll enjoy. How to work in combination of or combining both preparations, cosmetic preparations, and cosmetic equipment, tools, things which will not be too expensive, I assure you. And you know, for so many years I have been enjoying this, being able to provide for you and for all your needs, and all the entire Christina team. I don't think there's any other company that does so much, says someone from the audience. And Miriam is saying, yes, you respect us and we respect you, and life is all about mutuality. It's not a one-way thing. If people respect you, then probably you have earned it, and you respect them, then they have earned it, that's for sure. And really, straight from the heart, I want to tell you, this is the first time we're doing kind of a day like this, a seminar day, which we broadcast all over the world. I think this is really nice, and we keep getting questions from abroad, and I mean, really, it's beautiful. And there's another question from the audience which unfortunately we cannot hear. Discount on products bought today. I'm going to show a particular kind of treatment for acne-ridden skin, and then Michal will talk about some new agents, including something very new that you're going to see here for the first time, and then afterwards, hopefully, if you have enough patience, I'm going to teach you some skin massage for draining. And let us start with a few words on the Comodex series. You know, usually people want something new every day. Miriam, what's new here? What's new there? Now, I can tell you, especially if you are waiting for an agent that has proven itself in tests, sometimes immediately, sometimes over time. It's a matter of practice and time. There isn't any medication that comes out unless it has been tried and tested for several years. So when you have therapeutical agents, whether it deals with acne or hyperpigmentation or all kinds of particular skin problems, time is a tool that you can use in order to test the reliability of a product. How does it work? Does it have complications? Yes, no. So Comodex has passed all these tests. That's one thing. Secondly, with time, whenever some new raw material came into the market, that we decided that we had to add to the Comodex, or sometimes change with something else. We often do that with many series of products, lines of products. You have a certain foundation and you know that's good, and then you add something to it. And then you always know that you can be sure of your ground because you have a good foundation for it. Now, when we came out with the Comodex series, we know how intelligent that line was to begin with and has remained so. It wasn't only about the pimple or about drying the pimple. We looked at the skin in a more general way, in a wholesome way. It was a matter of hyperpigmentation due to acne, inflammation, even anti-aging of the acnetic skin was considered, or small acne scar. Looks better. Because when the skin looks better, you know, it has to look bright and glamorous and not dried. So at that point we understood that we had to be holistic, that we have to deal with every possible issue of an acne-ridden skin, because acne is not something that happens only in your youth. As we said before, it could go on in later years as well, and as we have seen and we have heard here, in later years, when the skin is very oily, sometimes we give a little bit of Comodex treatment or give some home treatment when it's oily skin. So we give something from the Comodex series, so because it doesn't just cover matters to do with adolescent years. So with Comodex we have a vast experience, not only in Israel. It has introduced us into many markets all over the world with all kinds of problems to do with different types of skin in Africa or in Asia. So what is it all about? Even when you treat using those agents that you use, I once did a little exercise here, a little trial, 5 beds, and I allowed the cosmeticians to go through this treatment stages. So I saw that one of them was using too much of the agent, another was rubbing too hard, a third one was leaving it on for too long, or the mode of application could be improved. So the same agent washing it off, rubbing, all kinds of things. We, I saw someone when given an unstressed treatment in order to calm the skin, but she was using it as if she was, I don't know, washing a garment or something. So there are some active agents which are strong enough, and we have to understand how they work and see how we can get the maximum out of this treatment. Now, for our purpose here, I decided to be a little bit more attractive, and I said, why give treatment to a woman once again? So I asked Asaf, what has he? No, he likes that very much. He's the one who said to me, Miriam, are you reserving the bed for me? At every conference, wherever you go, in Hong Kong or here, towards the end of the day. Do you remember? I remember that when started asking, I said, oh, that's seborrhea and all those pimples. It's time he grew up. And I had very oily skin and seborrhea in his hair, and every instructor practiced on him a little bit because he was willing, he was ready, he was willing to accept it. But the thing is, you see, when you have good chemistry with the patient or with the client, it's going to work out a lot better. The whole treatment will work out a lot better. I'm very glad when a patient comes to me with a recommendation from someone, because then she comes and she's already trusting, and she's relaxed, she believes you, and she doesn't worry if it hurts a little bit, burns a little bit. She knows that she's in the right hands, and she's seen results as well. And for me, Gali, with whom I work together, that's something that I'm always very grateful for. I never stopped working, by the way, and that's something I'm very grateful for. I do treat people, and I'm really very touched by that, because I'm already a third generation I mean, sometimes I have already a third generation. It's the same family, and when a client is so loyal, it is something which really moves me, because in this day and age, it's very hard to achieve that. So, speaking of genetics, there was one medical conference when they talked about genetics, and I said to a doctor, "Don't you tell me what genetics are all about. I know that. I see it. I have whole generations of people from the same family coming to me, and you see the improvement, and you see the trust, and you see, and you remember the treatment and you see that it's the same skin, is the granddaughter, and you're reminded of the mother and the grandmother." And sometimes Gali says, "How do you remember?" But I remember every pimple, I remember every condition, and I'm reminded of the treatment that we used to do, just with nothing to work with, actually. And I used to work at the Hadassah Hospital with Professor Taljum, and we used to do, I mean, there was so much we lacked at the time. And to see where we are now, I mean, I can't see myself. Sometimes Gali says, "Oh, I'm tired of this, I'm all worn out." No, I'm burned out. No. For me, it's never like that. It's like a kind of love that only grows stronger. You go places and you see the people that you have helped treat or treated yourself. I mean, nothing ever made me happier than seeing that you really helped someone. That she's not going through what her mother had to go through, because I didn't have the wherewithal at the time. And I keep saying to myself, "Oh, if only I had these when her grandmother was going through this." And you see, Nat is here 20 years ago, if you remember. Do you remember what kind of photos we were taking of acne? Today, no, there's nothing. I couldn't find anything like that. Okay, you go and look. Shall we put a hat on him? Not a band. No. Not a bow either. Not for him. I once gave training on how to treat a male patient. Nothing pink, for one. Not a pink sheet even, not a pink this is how we got you married. You're giving me bad reputation, he says. No, I'm just, yeah, okay, we upgraded him. We upgraded him. Okay, so I'm going to just play around a little bit with the Comotex. And see, and I'm sorry, our electricity has cut out. We get no sound. חושב שגם קבע, זה הכל קבע פה, אבל משום מה המיקרופון כן עובד. cleaning, I could, for example, in the area of the nose where there are more comedons, I'm going to do it but very, very gently. Because I divide the activity between several agents. I don't want to be too aggressive. I want to reduce the dominance of one agent and then gradually add more. So here we go. So I want to clean just a little bit. It doesn't have makeup after all, but generally men like agents that clean very thoroughly. So I'm going to take really very, very little indeed. I wanted to look at how much I'm taking. Oli deliberately put in a lot, so I just want to show you that the amounts matter. It's going to be rather diluted. I just want to clean. Now pay attention, Christina. Christina, who is also called Miriam, but Christina is using the Vigo Martian scrub with water. Usually we don't use that oxides are hydrophilic. It works on the hydrolipid layer. Salicylate like a lipin works on the lipoic level, that is, or layer. It gets through the sebaceous gland more than the glycolic acid. The beta-alpha calicyl has better penetration because it gets through the sebum barrier. It moves the oil. So this is why this is very important. Why don't you sit right here? So this is one thing. Now it also has the tomato extract inside, and this tomato extract, when we started working on developing this agent, first of all it's beta carotene. Also there's natural antibiotics. This has been studied and established, but it was very easy. I mean, I'm very happy to have something natural in every agent. I say if there's something in nature, you should utilize it. So I remember when I started talking to you about the cosmetics that we used to practice once upon a time. So if you had an abscess, let's say on your knee or something, we used to cut tomato, a rather hard tomato, and wrap it around that place for 24 hours, and by the time you were done, all the pus had gone. So there's something acidic in it which draws has a very important role to play when it comes to acne treatment. So I'm going to tell you something general about application of various acids, especially on acne-ridden skin. Dr. Yorav said already that it's not all the same. There could be some papules and some pustules and some comedons and sometimes seborrhea. You know, seborrhea goes very well with acne. Perfect match. In many cases, psychologically people think that oily skin is not sensitive, you can dry it as much as you want, but that's not correct. In many cases, inflamed skin, problematic skin is more sensitive, it will react more, it will develop redness, especially if it's very light in color, especially if it's around the center, the T area, where there is higher activity, enhanced activity of the sebaceous glands, and when there's seborrhea, the skin flakes a lot, and then you can see a lot of irritation because the agents penetrate the skin more deeply in the center of the face. And I don't know, I mean, I don't think that this is what you want after all. So how do I work with acids? What I do, I want a piece of gauze. I want a piece of gauze here, right. So first of all, the amount, a very small amount. You could take an applicator, you could take 2 small ones, or a little bit of cotton wool, or a piece of gauze, and I start from the sides of the face. And why the sides of the face? Because 99% of the cases the skin here is less sensitive, thicker, and the agents are less penetrable. So I start with the sides of the face, I go up to the forehead, and towards the end I get to this area. Even though it's more oily, even though you may have more pimples around here and more comedons, but it's more sensitive. And I don't want this strong reaction. That's why I only get to it towards the end. That's when I get around there.
I start with a very thin layer, and I can repeat it, and I start doing like this. Just a minute, Miriam. Miriam, the smearing method is so true, like what Miriam Christina does it. Many clients use retinol and acids and just see what happens to them in the nasolabial area. She has to speak closer to the mic, and that is why this method of applying it is much more sensitive for the nasolabial area. If we are talking about male clients, the beard, and if we go from the bottom to the top, it's going to be more difficult. Even with women, I saw it in more powerful peelings. I do one application with the direction of the growing hair, and one the other way round. It starts from the follicle, and we know that the follicle can clog the sebum glands, and I do it once in the direction of the growing hair, with the direction opposite the direction of the growing hair, and the other one with the direction of the growing hair. Usually there's some more fatty areas here, and I get into the hair, and I really explain to my students, to my patients with fatty skin, to wash their hair more often. Is it okay, Asi? Wonderful, says Asi. Okay. This a little bit jelly, and before the end, I try it here. You can go down to the neck, especially if there are pimples there, but please remember that this part of the skin is very sensitive to acids before the end of this. So first of all, the whole face is being smeared, and then you wait. You ask the client how she feels, and since I'm going to go for another peeling hair, had I not decided about the additional peeling, maybe I would have applied another layer, but I want to leave the skin not irritant, and because the treatment should not be irritant, so I put a thin layer. I distributed it over the whole face, and I'm waiting a little bit. Time is also important. In acids, there are a few criteria. We know that it's the strength, the pH, the type of application, the time it's left on the skin, and the reaction of the skin. It's very individual. It depends on the skin and on the preparations that the client uses at home. So there are a number of factors that actually determine the reaction of the different acids when they come in contact with the skin. So this is a small piece of piece of gauze, but when you use a brush, it's not the same thing. But if you use a brush, you should pat with your palm, because only then would it be equally distributed. This dispersion of the material is something that I learned from you. Sorry, I can't hear her. There's a problem with the mic. That's why I said that the type or the method of application, you will see that you are in control. It's not that you put everything just like that. You get into all the crooks behind the ear sometimes, because there we've got fat as well. Because if you start in the middle, the patient immediately asks help, says help. She wants to get rid of it. And if it's a thick layer, well, again, even when the layer is thin, it's being absorbed and it works. Do you feel any burn? Sunburn. Okay. He shaved. Listen, it depends. Asi doesn't have this type of skin that is very irritant, and when people shave, it's problematic. Did you shave? Yes, I shaved yesterday. Well, the bristles of the beard are very important. If really the skin is more sensitive, or when you have shaved previously, recently rather, not previously, you'll feel a certain type of burn in the areas that have been shaved. So let's say that the patient should shave, well, it depends, sometimes a half a day or a few hours before the treatment. Okay, I like to wash acids with a cold water, as cold as possible. It's very comfortable, it's very agreeable. You calm the skin, you don't have to use any neutralizing material. Cold water, it's nice, and you feel very well. Well, almost everywhere the room is being warmed, being heated. Okay, I'm not going to answer you while doing the peeling. So we wash it, and you ask the patient if everything is okay. Don't stop washing until the client says everything is okay. Especially salicylic acid, the skin neutralizes it automatically, but acids, alpha acids, we need to not neutralize them if we want to stop the activity. We have to neutralize it. I'm a little bit too high. I thought that it was because of the camera, but I'm not seated properly. Okay, we should put him down. Can you see? Okay. So cold water, as cold as possible. You feel very nice. You feel fresh in your pores, and then cold water, and you wait. Don't rush. Even after the scrub, I simply go more quickly because of the constraint of time, but nothing happens if you wait a little bit between every stage and don't let the skin rest. One step after another, wait a little bit, and if everything is okay, go on. Let the skin its peacefulness. And now number 4. Again, an antiseptic material that warms the skin, and it helps us clean the comedones because it softens the sebum. Because when the sebum is rigid, it becomes softer. It softens not only the skin but the sebum as well, and the blood flows much more easily in the different vessels, because good blood flow has a major role to play in the healing treatment. Some people get redder. Again, the quantity decides about that. This is number 4 in Comodex. It's a material that softens and warms up. It's an antiseptic, and it's very important for all of us to have an antiseptic material, to be used it before we clean the comedones and not necessarily after that. You know Louis Pasteur's rule to disinfect the skin before the procedure. Sorry, can't hear her. The antiseptic material. Okay, so I'll start. With the nose. Here the reaction is going to be more powerful. I can start from here as well. If the skin is very sensitive and it depends on the quantity. If it's a bigger quantity, you become redder, and it softens less as well. If you had some experience experience with this specific patient that has become really red. It's if you don't want it, you can do it topically, where you clean and only a little bit in the other places, not the same thickness of layer over the whole skin. It warms the skin up thanks to extracts of peppers, capsicum, an extract of mint, horseradish root, and other extracts that create better blood flow in the capillaries and gets the temperature of the skin up and opens the pores naturally, and there it would be easier to take out the comedones. Don't forget that there was in the peeling the salicylic acid that softened the sebum, so all the cleaning process is going to be very easy right now. This product is really one of the most outstanding ones that we have in order to clean comedones in the easiest way possible. We don't have to put nylon sheets on it. It's good. It's really works miracles in opening the pores and cleaning the comedones easily. If you use it on a desiccated skin, it's going to be much more difficult for you to clean the comedones, because the skin is dry and constricted. But if not, put a warm water bandage, and I like steams, because steams, it's not necessary of the couperose. All in all, a sweating skin also is cleaned. Sweating is a type of cleaning, and so it's okay if you make the skin sweat a little bit. It's a type of cleansing or cleaning as well. We have ozone in the steam machine. Suddenly, people started to talk about it and gave it bad reputation. Now I would like to show you. Do you remember that we talked with Dr. Yorav about the cleaning of cysts, cystic acne, and he also understood that you have to clean them. And I'm talking about cysts that can stay for 6 months or even more than that, and it recurs from time to time. There is an opening of a comedone, but you almost don't see it. When you take out things of it, the dark blood gets out of it, and the pain is caused because this blood pressurizes, and it leaves a mark and it leaves a scar. And from my experience, I know that the right way is to drain it out. There's no other choice, and if you do it in the best way possible. So we are softening, and even comedones that I take out, open or closed ones, I am not doing things forcefully. I release it. If you have a scalpel or a good needle, I've got this needle that I like very much. Look at it. I don't know if you can see it, but it's like a small diagonal knife. It's a needle that I got familiar with when people used to do it for transplanting hair. And what do I do now? Well, I'm showing it to you. I'm working in a very hygienic way. I stretch the skin, I get into the thing, and I press. Since there's a pollution, not pollution, since there's infection there, we want to close it. What do I do? Wherever there is some bleeding, I take a pipette or something with hydrogen peroxide 3%. That's it. It creates this fermentation, and this fermentation is antibacterial and also coagulates the blood. You can see it. It's like this small frosting. And then I clean everything on the spot. The hydrogen peroxide is clean. The needle is clean. Everything is clean. I put a piece of gauze on it, and then I give the client some material, night Comodex, Rose de Mer. She can use it. Rose de Mer is really wonderful because it drains it out and it prevents pigmentation and the scars later on as far as possible. And then at home she uses the Rose de Mer soap, and if it's a very dry skin, I give her retinol E to use on that space. It's very important. So when I clean a closed comedone, sometimes even the open ones, this pressure, there are two risks. First of all, that you put things down, and Yoram said I get so many people that come to me where they exerted a lot of pressure and they really tore the skin up. I really like, I'm showing you it on the nose. I release it a little bit. You see, I don't have a loop, so it makes things difficult for me, but I am helped by a small needle. I open, I get into the diagonally, I get into the lesions, and here you don't have it, but you can use even a regular needle. The idea is to be in control. I don't have it, but we have the pictures of this specific patient of mine with a regular needle, disinfected with hydrogen peroxide. You will see it in the pictures of before and after. You can't even believe that this was the case before. And Christina Miriam is right about this velvet blood that gets out of those comedones, but it creates some pressure and pain in this place, and if you don't release it, the pressure and the pain is going to be permanent, and there's no way to cure it. You can see it, how it went out, so how it went by so beautifully. Can you see it, how it gets out easily? Okay, very nice. Can you see it? Can you see it? My palm. So I clean it. The skin is an antiseptic condition. It's very important because, and not later, the skin should be first of all in such a condition. Can you see it? Can you see it? How easily it was taken out. It's oily hair or skin, soft, flexible, not dried by different materials. So number 4, that really warms up the place, is very easy to clean with, and the skin is antiseptic, and then the blood flow supplies a lot of oxygen to the cells and doesn't permit the proliferation of microbes, and they don't get out even when you wash it. These substances remain on the skin, and it's very important to prevent any potential problem. Now I'm going to show you something really new and special. After the cleaning stage, I am going to, who hasn't seen it? Nobody. Okay, so come here. And now Michal, can you explain? Michal is going to explain while we are waiting for the skin to rest a little bit. Please explain to us about this material, which is both old and new. A few words about the new peeling, but she isn't speaking into the mic.
It's based on the Rose de Mer peel and plus a few changes. The main thing, well, actually, I'm here to talk to you about new materials and new technologies. So here we're using both new material and new technology, which is called the blue biology. We call it blue biology, but it's actually, what it means is actually that it's marine biology, and except the I mean, on top of the coral that you know, we also use a certain kind of algae which is has a very strong antibacterial and anti-inflammatory activity, which allows us to reduce inflammation of the skin without the dryness and the irritation which are typical and that we've been trying to reduce for a long time. Now, if you remember, Dr. Kunis spoke this morning, you probably remember that he talked of minisarcazine, which is something that he mentioned this morning. So we have soap powder which is based on the sarcosine amino acid, and it has an antibacterial activity as well, on top of its very gentle activity. And this is what the Comodex has, which is unique. Now, even if I go through deep cleansing, and even if the patient has been fiddling a little bit with their hands, so let me give you an example. Often, even if I don't use Comodex, but any kind of treatment, and I'm not going to just send the customer home like that, the patient home like that. Even with the cystic acne, she could come for a wish treatment or Forever Young or any other treatment, Muse, whatever, but she's still stuck with that pimple. I'm not going to send her home. I'm first going to focus on that. I'm going to open it. I'm going to disinfect it and use the Rose de Mer, not the Rose de Mer, but rather the foundation. But I'm only going to work on that spot and then apply the mask and send her home without giving her specific acne treatment. Women of a later age, for example, who pull out hair, so they fiddle and they get the hyperpigmentation as a result of trauma. All these cases, she doesn't have to come, especially while I give her the treatment. It's like a sort of a first aid. It's there on the table, almost for everything. I always have something that I find that I need that for, and I need to do some extra treatment rather than send her home without treating it. Another focus with the marine peel, the Comodex peel, we focused on its ability to heal the skin, unlike the Rose de Mer peel. That's more about skin regeneration and renewal and revitalization. It's more the disinfection and sebum inhibitors. Now, this material is pleasant and it's gentle and it's like applying mousse to the face. Now, after cleaning, immediately after cleaning, before disinfection, I don't need to disinfect. I don't need to disinfect. The disinfection was number 4. When you did the stage 4, number 4, you don't need disinfection after that. That in itself is disinfection. Please, the disinfectant is included in these materials. You don't need anything else. skin, but they do have lots and lots of miliums. We open them, and this peeling just comes off without any kind of marks, nothing afterwards. But do give her something with retinol. It could be retinol E, because you have to give it afterwards, and with time it just finishes it off. So even if you clean miliums in this area, that's the typical area, you could do some other kind of treatment just for here, and then do the marine peeling. Look, there was a question here we couldn't hear. She says, I don't think you have so much acne vulgaris. If you do, then send her to Joran. If it's really acne vulgaris, just send her to a doctor, because don't lose your time on that. Don't waste your time on that. Talking about very severe acne. I'm talking about acne, you know, papules, pustules, and those cystic cases. I mean, I hope that but there's antibiotics and other things that can be taken. And like Christina said, stop the chain in the earliest place possible. And yes, get help from a doctor when necessary. And don't get the pimple to become so deep that it causes damage. It opens. You asked whether this does some peeling. Yes, it does some exfoliation. It exfoliates a little bit. Look, the name of it could be peeling, because peeling is a common word and something that people say and know. But it could be the sort of peeling that peels off the dead cells, or one that peels off some living cells. But when you remove dead cells and open up the hair follicles, that's just exfoliation. It's not real peeling. We only peel off the dead cells. It doesn't peel off the live cells, the living cells. The skin itself is not going to peel off. The hair follicles, the clogging that we get there will be opened. We do need the peeling. The peeling is important because the P. acne bacteria don't survive once oxygen comes in. It cannot live in that sort of environment. Secondly, we also very gently peel off the melanin layer, which could result from oxidation, from some kind of injury, and that's the very upper layer, and it helps to drain it, to heal the skin. It doesn't dry so much. It peels the skin, and it helps it heal. So you'll see very gentle exfoliation rather than the deep kind of peeling that we know. It's not a matter of peeling really, it's a different kind than the one that you get using acid. It's called Comodex Marine Peel. It's not out yet, it's not out in the market yet, it's not for sale yet, it's all new. Miriam has done a lot of work with it in the clinic. Like Christina is saying, we are doing in vivo trials, so we had lots and lots of them. We don't try it on animals, we go right for humans. So it's not out in the market. You're the first ones to be exposed to this agent, and every such course that when you come to us, you become aware of the newest innovations. Now, I've put a compress on it with water to make sure that it keeps moist. I don't want it to get dry because the active agents will dry and stop working. I want to keep it moist, especially when it comes from the water water, from the sea when they are wet, they're active. So in moisture conditions, it will continue working. Just ordinary water, that's all, tap water. And keep it on for about 10 minutes or so. It will be an excellent disinfectant, especially antibacterial. The fact that Christina rubbed the material onto the skin, the substance onto the skin, allowed the skin to absorb the antibacterial agents. That's one of the more important elements of working with this, in order to allow the antibacterial active agents to penetrate and do what they have to do. And, when's it gonna come out? In the coming few months. Now, for sale, well, I hope as soon as possible, and from a price point of view, I hope it will be as expensive as possible. No. Well, Christina is the one who always says, no, it's too costly, it's too expensive. Please, let's push the price down. No, you have to knock it down, and let's give them something for free. I don't know where you get that face mask. I can't remember where I got it from. Maybe I brought it from some other country. I don't know. It's this thing. I think they market it. No. It's not the one. There's this thing. Okay? It's not gauze. This is the form, and there's another one. There's this one. You drop it into the water, and it starts puffing up, and it's really very nice because you could put all kinds of extracts and all kinds of things in the water, and then it sort of blows up and it opens, and you have a face cover with all kind of extracts. This comes from the Far East. When you go to the centers, it's not expensive. Yeah. So let's continue, because we still have biophyto treatment, and we have presentation. We have many pictures before and after. Yeah. So, okay, so here you see something different. So, I'm taking this off. Washing it is relatively easy. Rinsing it off, because would you like to do that? Why don't you? Why don't you clean it off? No, I want to be treated by Miriam, not by Oli. What does it feel like? Well, it doesn't burn at all, says the patient. It doesn't burn at all. Okay, just let's repeat what he said. It doesn't burn at all, even though the skin is red. Asi, how do you feel? Okay, so Asi said that the peeling doesn't burn at all. He has some experience with all kinds of with other kinds of peeling. No, you don't feel any kind of tingling or burning or anything. Really, really pleasant. And there's some comment from the audience, but I'm sorry we cannot hear it. Apparently Miriam is pleased with what she hears, and she says that she's also learned a lot from Oli. And Oli is saying, I am privileged to be so close to Miriam and learn so much from her. Just believe me, there's not a single person that you can't learn anything from. And if you think that you already know it all and you have nothing more to learn, then that's the greatest mistake. You can learn from a student, you can learn from your patient, from your client. They will be your best teachers. Your patients will be your best teachers. So now there's no burning, nothing. Okay, yeah. You can learn how to work properly here. Oli always says, okay, one of them is they're antioxidants. Secondly, if the skin is not of uniform color, and usually in acne there is some kind of coloration, some kind of pigmentation perhaps, in order to get a uniform skin color, well, that'll make the skin look nicer. So what do I do? On the same pad, in order not to bother myself and the patient, doesn't come from the same bottle because you don't know what the reaction will be, but on the same pad, I take a little bit of this and a little bit of that. So the thing is, you don't put it in the same dish, so there won't be any reaction between them, but I put them on the same pad. Now, why are you being so generous there? Apparently that's too much. So here again, don't rub it, just place it like this, apply it, patting the skin very lightly. So this is number 5 and 6. That's retinol, and it's lightening agents with kojic acid. It makes the skin color more uniform, healthier, and also anti-aging. You've heard already that all these materials for lightening the skin are also anti-aging materials. So you see, here it goes. This is how I do it. I pat the skin, I don't rub it, because it's already, and I wait. So, do you have beauty blobs here, so I can apply those a little bit? So the beauty blobs, here the water is not cold enough, but you should try and get it as cold as possible, and you use the beauty globes. When it's cold, it's smoother and it slides better on the skin. It really doesn't burn at all, says the patient. It's really very pleasant. Well, everything, just a little bit. Everything is very light, not very heavy at all. We usually don't do massage on oily skin or acne-ridden skin, but look. But if we go over it with the beauty globes and we cool down the skin and we contract the pores, and that will feel very pleasant. And after all, you have to let them enjoy themselves a little bit, not just cleaning all the time. A little bit of pleasure there as well. So, okay, remember? Pay attention to this area here. From the corner of the eye, the inner corner of the eye, down to the mandible. This is very important. Just pay careful attention. There's a vein there, and if we have any kind of infection of the face, the drainage is very important. This is where we drain it, and then we go up and all the way in the direction of the lymph. And in the center of the face, up and then down, and afterwards I'll do that with the glass finger, so you see this is the direction of the movement. Very important movement to trace when there are all kinds of infections and inflammations. And another thing which is nice to know, if you have closed or open comedones, just do this a little bit, jacquet, just like you do before draining. We just a little bit. It's Professor Jacquet, and there's a small Jacquet and a bigger one, and I show you how to do it in a way which actually cleans the skin. It used to, when I worked together with Professor Tadja, he would sit us down and said, do the Jacquet. So we used to do that. Just find an opportunity to do it. And now we're moving on to the mask. Now I'm going to apply the Comodex mask. I'm going to leave it on the skin and apply the Comodex mask. And here I'm going to put on
a little bit. If the mask dries up very quickly, what I do is I take a little bit into a small bowl, and with the clean water I add a little bit, and I put the water into the mask, and I apply it. But the idea is to measure it beforehand, since there are many volatile substances. You should take a small box, 50 milligrams, to use it. Not every time to open the big box, because of the volatile materials that evaporate. This is a solution, but we are still working on it. And I can tell you that I've left a box open, and you saw it in the lab for a lot of time, and it didn't dry up. And I leave it, let it dry, and when it dries and contracts, the washing is very important. I do it with a bandage of water, and not with water. And I put the bandage on the skin, and I can wash it very easily. While Asi is going to stay with the mask, maybe Michal, I'll give you the floor, because it gets late, and I would like you to start, and Asi will stay with the mask. A little bit, okay. It's going to dry up, it's not going to burn. Well, again, is it okay now? I was asked by the people from Russia to repeat the components of the new marine peel. So in the activator we added Artemisia and Centella acetica in order to give the feeling of calmness. As you see, Asi said that it's not burning at all. And Yefat Coral is that we know from Rose de Mer, together with a new blue algae with an antibacterial and anti-inflammatory activity. And we hope a very fine soap powder, which is based on the myelocysteine soap powder, that it's based on the aminocysteine acid. So you've got something that cleans things, and also some antimicrobial activity, and the prevention of the secretion of sebum. Okay, now we are going to speak about the new materials. Can you hear me? Okay. Okay, I've been asked. Please sit down. I've been asked to talk to you about new technologies and new raw materials for the treatment of acne. What about the presentation? Dr. Kunis and Dr. Yurav have already spoken about acne, so very briefly, what is acne? Acne is an inflammation of the sebaceous glands and the follicles. Who am I? I have already been introduced at the beginning of this day. My name is Michal Cliffer. I'm the chief scientist, chemist at Christina. I'm responsible for the R&D department. I'm the third generation in this domain. My grandfather was a very famous pharmacist, and my uncle is one of the most known chemists in the world. He's called Mike Cliffer. I took my first degree in chemistry and my second degree in the pharmaceutical department in Paris, and then I worked in Monte Carlo in the Lancaster laboratories. I worked for 10 years in Chlavin, and here I've been here for 9 years. Acne, very briefly. Acne is an inflammation of the sebaceous glands and the hair follicles, a surplus sebum that is aggregated in the pores and creates a good environment for the proliferation of P. acne, that is the bacterium, and it creates the pimples, zits, acne, however they are called. Today, the approaches that are common today As Dr. Konis has already told you in the morning, there are a number of approaches that are based on treating skin problems, and the main ones are the renewal of the skin, antibacterial materials, the inhibition of sebum secretion, and alpha reductase, and the coming down of redness as a result of inflammation, and enlightening the skin in order to hide possible byproducts or side effects of the acne. I'll speak very briefly about new materials and new technologies that are based on acne or are targeted to acne. As for the renewal or the peeling, we have a biomimetic peptide whose role is to accelerate the curing and the renewal of the skin, because a major part of the acne has to do with bringing the skin in a normal situation to renew the cell turnover. This role, this peptide works on the activation of the creation of ECM proteins and that are involved in the correction and healing of the skin, and by renewal the skin tissue, the skin becomes much more unified. And you can see here in a graph that was prepared for the fibronectin and laminin, and you can see here that after a month in a concentration of 0.03%, there is an increase in the different criteria that attest to the healing process of the skin. As for concentration, it is important for me to tell you that this material comes as a powder. It's not liquid, so it's not mixed with any other substance. So it needs a very low dosage of active material. Ocievatol Jack, that you know in the Biophyto, because you can't distinguish between these two series, and it has to do with the supply of oxygen to the skin. This is a complex of polysaccharides and glycogen that improves the supply of oxygen to the cells and also helps the process of cell renewal. The normal consumption of oxygen encourages the normal activity of the cells, and the renewal of the skin tissues enables the unified appearance and camouflages defects and scars. This is very interesting in feeling alpha hydroxy acid from a new source. This is a plant that it's an Australian fruit that is called pearl lemon. If you see its structure, it contains a small balls that really remind us of caviar. You have different colors. In fact, they have a different concentration, especially of citric acid, that is very good for anti-acne treatments. These capsules contain beta-alpha hydroxy acid, and the skin peeling through with the TRV3 receptor involvement. In a minute I'm going to explain to you how it works, and we get the result of a fine or delicate peeling process. What's special about this acid? It's the biological mechanism, the process of skin renewal. Okay. In fact, by intensivizing the receptor TRPV3, we open the ionic canals that the cell that the skin scales have, and this enables the penetration of more calcium ions that create a burden in the cell, and they accelerate in this way the removal of cells. You see, by the acceleration, we enable a better penetration, a faster penetration of calcium ions inside the cell. In the past, and also the entrance creates a burden and overload, and then ionic canals open, and then the removal process of the stratum coroneum is taking place more rapidly. In fact, we can say that this is a natural exfoliation process of the skin cells. As for the bacterial activity, we have combined two peptides. One is a mixture of extract and peptide that inhibit the proliferation of P. acne. The oligopeptide oligopeptide 10 is a special oligopeptide with an antibacterial activity that works synergistically with salicylic acid, and it penetrates the pores and reduces defects and inflammation. It enables also the reduction of the salicylic acid dosage. Some clients are more sensitive to this acid, and another combination is the extracts of honey and the boswellia plant, and they calm the skin. Sorry, can't hear the question. We are improving and upgrading all the time. So these are the active ingredients that we are adding now to the series. We don't change it all over. As Christina has said, we are basing ourselves on what we've got, and we simply upgrade the active ingredients. And the marine peptide, as I've already said to you, it's based on blue biology. This is a new technology for the development of active ingredients from a marine source. Study in people 13 to 27 years old with the blue algae, the usage of a cream that contains the peptide from a marine source, we received the results after 28 days of usage, and the researchers checked the redness and the number of lesions. On 0 day it's 56, after 28 days 41 lesions, so it's a decrease of almost 30% in 1 month only. Now, what's important to note is that we do not check only, once we treat, there are no signs, and that's wonderful. No, the idea is to preserve things on a long-term basis, and that's what's good about this algae, is that even after 28 days, there is a very nice decrease in the redness and lesions. Christina wanted to show you the product, the peeling product. That's why we spoke only about that. Another picture, you can see here the same thing. 0 time 121 lesions after a month, only 93, almost 25% reduction in the number of marks of lesions of boys and girls 13 to 27 years of age that use this material on a daily basis, one application per day. And then they improved some parameters that are important for acnetic skin: the number of pimples, the size, the reduction of redness, the number of pimples that was removed, the healing, the general appearance of the skin, and also something about the pustules. And you can see here that the results are very impressive. The size went down by 55%, and I'm talking about after a month. The redness went down by 61%. The quantities went down by 42%. The healing process 77%, and the overall situation of the skin, the visibility improved by 61%, and the number of pustules also went down by 52%. As for the reduction of the secretion of sebum, we use here a technology which is very interesting with the new transmission systems. It is being researched in recent years a lot. There are a number of systems. Depends on the goal. The transmission system that we use is very like a liposome, but it's double. First of all, what do I mean by transmission systems? These are the systems that enable a better penetrability, and that's also why the effectiveness is better. And there is a certain encapsulation process that makes them more stable and also increases their penetrability into the cells. This is a double liposome, and what's interesting is that it can have two types of active ingredients: the water soluble and the oil or fat soluble. So you can take two active ingredients and put them and penetrate them in a better way, and the result is going to be improved. The complex that we have been using is a mixture of active ingredients from botanic source. The nobiletin, which is a flavonoid from citrus fruit, it reduces the triglyceride that is the major ingredient of the sebum, and it also reduces the creation or the formation of sebocides where the sebum is being created. So we reduce the triglycerides, and they are not disintegrating, and we also reduce the cells in which the sebum is created. We create at the end of the day a reduction in the creation or the formation of sebum. also found out that this material reduces the activity of 5-alpha reductase, and we checked it vis-a-vis the testosterone hormone. The minute they found out that there was a reduction of the testosterone, in fact, it meant that dihydrotestosterone. Thank you, Yoel. Dihydrotestosterone. So by that, it means that there is less less material created, and it means that there has been a reduction in the formation of hormone, shows the inhibition of the creation of sebum that plays a major role in acne. Another material from the blue biology, and we've mentioned it before, is the matmarine. It's a material from a biological source, from an algae, that is supposed to reduce the shining and the size of the pores. The way in which it works is that it in fact reduces the MC5R protein that takes part in the process of creation of the sebocytes. This is where the sebum is being formed, and there's less sebum created, and it also encourages the creation of collagen fabrics, and the pores become smaller when the skin is stronger, more robust, and not slack, and the pores look more closed. And the last point, it has to do with the transmission. As I've said, we are using different ways of transmission in order to hide the defects that are created as a result of marks, dark marks that remain on the skin. And our system, the Neolite system, is also an innovative transmission system for the active ingredients. Okay, the next page. Most of the materials that we find today in transmission inhibit the tyrosinase activity. We hear about that all the time, the tyrosinase. So I wanted you to understand what we mean by that. We've got here in the cells a material called tyrosine that turns into melanin. By the way, we have two types of melanin. We have phyllomelanin and euromelanin, and one is responsible for the black and brown pigment, and the other one for the red one. And the minute we inhibit the activity of the tyrosinase, this enzyme, we actually inhibit the production of melamine. This is the whole story. Most of the ingredients in according to its structure, like the tyrosinase, and that's how it inhibits the creation, the formation of melanin, not melatonin. This system, in fact, enables us to get to the melanocytes, where it works against the anti-tyrosinase, and you have an effectiveness of 23% after an average usage of 1 month. That's it. Into the mic. I can't hear her. Most of the products are still in existence. I assume that in the very few months ahead, some of them are going to be available on the market. The marine product is going to be the first one. Now Asi is going to say a few words, then we are going to show you pictures that were sent to us from different countries in the world with the results of the treatment from Japan, Korea, Hong Kong, Russia, different countries. and you will see how nice it is to see the results of treatments and not things that I only did, but rather people from all over the world. Asi says, say a few words about how you feel. I feel well. The peeling, really, I didn't feel any tingling, anything, and I did go through the rose peeling, and even after the massage you feel it. Here I didn't feel anything. It was really nice, and as usual, you know, it's Miriam's hands. Really, if it's good for men as well. So I'm going to show you now, in order to have a pause. The next treatment is going to be BioPhyto, but please look at the pictures of before and after. I'll go over to sit there, and people, these pictures are from Russia, if I'm not mistaken. It's a doctor. No. This is this doctor in Russia that works in a hospital, and she did a very good treatments with the Christina materials, Comodex and New Oxygen and BioPhyto and Rosdemer, and she sends us all the time pictures of the results of the treatments. I would make it shorter in order to show you the before and after pictures. And most of the treatments are short. It didn't take a lot of time, 1 or 2 months, and very nice results. And why? Sorry, there's a technical problem. We can't see anything. We can't hear either. Sorry, she is, you know, in her clinic in the hospital, a very well-known hospital, and we are in a number of serious hospitals, and we've got a place in Cuba as well, in Korea, and I'm going to show you the differences of weather, how the skin looks different when it's cold, a cold climate, and the skin is more irritated and dried up with these strong winds, vis-a-vis humid and hot weather with the pores bigger, and it's more of an oily skin. You can see that the ethnic origin also has its influences, stress influences, but the ethnic origin has a great effect. We'll see the differences between different types of skin in different environments. And sorry, I can't hear her. I can't see the transparencies either.
Okay, we have a little question for you. Do you want me to see the BioPhyto first, and then if there's time, we'll show you the picture, or the other way around? Because Thomas says that's better. Okay. So, okay, and if you want, you can stay and see the pictures. Because no, you work, and then they say, well, what are the results? Okay, so I like to show the BioPhyto for problematic skin, because I would do it for you. I mean, because it's possible. Anyone could. How do you define your skin? Sensitive? And sorry, I can't hear the answer really. I, so, okay, we're going to do the biofetal, the different type of skin, and I'll explain the skin and what I do. And then afterwards, if you want, you can stay and say results and see the results. And if not, I believe you probably believe me. Really beautiful work. Okay, so we're going to do the biofetal and then show the pictures. Okay, that's nice. Well, since we're talking about the acne family, the types of acne skin that reacts different skin color, then Inbar came up to me and said, "I want biofeto treatment," and biofeto is a kind of treatment. Well, we made it in this way that I don't think there's any type of skin that can't be treated with biofeto, but the thing is because it works deep inside the skin, getting better blood flow, all kinds of things that happen inside the skin, and then it has some agents that work on the surface of the skin. So every person, everyone can do it. Each of us has. We all have the same skin basically. We need to have good blood flow, good drainage. We need regeneration of the skin, and then each of us individually, what's most suitable, and biofeto is works like that you can afterwards go and do or focus on what you need, whether it's sensitive or seborrhea or whatever. So Inbar, will you come here? So now I need the glass finger. No? So I look at the color of Inbar's skin, and as you can see, it's Fitzpatrick 3. She has a little bit of pimples. Acne is still a little bit active. Are you just very young, or is it just being prolonged? Yeah, no, I'm not that young. Okay, so Biofeto is going to do a very good job here. First of all, cleaning the skin, letting it breathe. And, Biofeto was our first agent that we've been using for the past 32 years. and it keeps spreading more and more people like using it. You say about the scent here, so because whenever you come into a salon, you can recognize the smell immediately, like a forest or like a green pharmacy, says Orly, my private green pharmacy. And I think it makes you feel like you're in a forest. That's why the Yarota Carmel Hotel was so happy when we taught them how to use it. You know, that's a hotel with a very famous spa. So, okay, not very happy with this mic. I think I'm gonna eat it if I'm not too careful. If I'm not careful. Okay, I think now we can. Now we're ready to start. Okay, let me lower the bed just a little bit. So with the biophyto, just as I do with the Comodex and with other materials, other agents as well, always very careful about the quantities, about what determines whether it's alpha acids or others. So Oli, will you help me here so we can just run through this? So now we are about to begin, and Oli will explain as I work. She'll explain about the green cosmetics and all those things. Now, the thing is that we have agents here that we're very familiar with, but we have tried to individualize it and also to build it up. It's not just the biophyto by itself, but rather it has every type of skin, every type of problem gets its own solution. So I'll start off by cleaning. The biophyto series has no paraben, SLS, petrochemicals, which Christina has gradually stopping to use in all of its lines of products in order to adapt to what the market and clients want. This soap is based on a natural cleanser, and that's the coconut. That's the coconut plant, which is has natural cleaning abilities, and that's what it's based on. Let's forget about the mic, and Oli will do the talking. It's just too complicated to handle. Trying to find another solution for the microphone, which Okay, let's just hold the microphone here. Okay, so you can use this soap even to uh, clean the eyes, the lips, no problem at all. You see, comes off beautifully. I'm not cleaning that well, but you see, it all comes off. It doesn't contain the SLS salts, which usually burn around the eyes, so it takes off everything. You see, very beautiful. And now number 2. I do a balancing here using the tonic to give the skin a good feeling, and I can use it even without the biofilter. And I just after removing the biofilter, that's use it in between different stages. We have this for sale as well. This is based on herbal extracts, and they also contain the cucumber extract, the allantoin, chamomile, alcohol-free, very soothing. Doesn't have all these less healthy detergents. It's a product that I really like to use. You know, sometimes we clean acne-prone skin, and the skin is so sensitive afterwards. It burns, and this just doesn't burn. It's very pleasant, very skin-friendly. And you see, even around the eyes, of course, don't get into the eye, but around the eyes, you can use it, not use too much, not like, you know, pour it all over the eye, of course, but clean it. And just think about all those young women who doesn't like to have their skin burning and have their skin have such sensitive skin. Okay, now I have cleaned it, and now I'm going to choose. Here we start to match the treatment individually to the skin. I asked Inbar, and she said, look, I know the biophyto, and my skin reacts very much. It is it reacts to all kinds of acids, and that's why I'm going to choose the weaker option. But before that, the gel. So here I use a gel in order to clean the comedons, and it cleans the skin very very nicely. Now, if the skin is thicker and there are more comedons, you use a thicker layer. If the skin is gentler and more reactive and thinner, apply a thinner layer, because for thicker skin you need more. So here I take a little bit of the gel, and I want this. I want a dish, and I want a brush. Right. This is a plastic face mask, which I brought from Russia. I brought over from Russia. Next, for the next cosmetic conference, we're going to all go to Russia and bring some of those. So Inbar says, I don't know her skin, but she says, Miriam, it's very delicate, and she doesn't have comedons, and especially now. So here as well, I start with the sides of the face, and often when it comes to the nose, there are more comedons than other areas, or on the chin. Then you can apply a thicker layer. Now this helps us puff up the skin. It fills the keratin cells with fluids, but it also contains some soothing agents and helps heal the skin, because in many cases with acne the skin is injured. So we have aloe vera, we have artemisia, which helps soothe and heal the tissues. There's urea here that puffs up the skin and loads it with fluids. Now, again, the name is peeling, but this peeling, just hold on. Let's repeat the question. Why, in this series, the peeling comes after the puffing and after cleaning the comedons? Look, when I accumulated my experience working with the Biofito, it is still called peeling because it removes dead cells from the skin, but it has disinfectant features and characteristics, and draining the skin, and these are really fantastic. So that's why I use it after the cleaning. If you like to do it before, well, I think you should still stick to this um, uh, um, schedule or steps, because the reaction is different. So that's why first of all I condition it, then I do the comedons, and then I put the peeling on. It burns just slightly. So it's best to stick to this routine. It does burn a little bit, okay, so it doesn't really matter much. You say to the patient, yes, it will burn a little bit, but it really constricts. It's antiseptic. It constricts and it heals, and the skin gets a nice shine. You know, I've been working with it for 32 years. I've done all the versions possible. And also, we get feedbacks from other cosmeticians, the learning curve, and our ability to learn from our students too. So quite often, uh, cosmeticians have been working for years with the Biofito and are not willing to let go of it. In cases of oily skin and acne-ridden skin, Biofito after the deep cleansing, because it makes the skin beautiful. Biofito for seborrhea is just legendary. You can use Biofito and Zaltal together, but it really is it heals. You can use it right into the scalp, and we have made a home version because it really is prophylactic. It stops seborrhea and rosacea as well. It works very nicely on that, because that's actually acne of the capillaries. It's true that it makes it a little bit red, but it really cures it. So even if the skin becomes redder, it's okay. It's just blood flowing, no problem at all. Better blood drainage. And the patient will also come out with his skin smoother and with a more uniform color. All the puffiness, all those little edemas that are a result of the deep cleansing, just smooth out. There was a patient who came out after being treated with Biofito, and another was waiting outside, and she said, "Is this the way you look after a facial?" I mean, really, you don't even see that she's had a facial. Everything has a learning curve, you see. It took years until we learned the exact characteristics and how to work with glycolic acid, for example. It wasn't that simple until we understood about the pH and about how to apply it and to who and what exactly. It wasn't something that you just bought and knew immediately how to deal with. There are things that you learn with time. You learn how the skin reacts and where you can get the best results. Now, I'm going to clean and you can cleanse. Some clean a certain area and then start working on that, or remove some of the plastic and work on that. For example, let's say, I'll show it again. Like slow exposure, gradual exposure. You can start with this and then it stays on the other side, or like this. Okay? Or the other way around, you find the way that works best for you. But now, after you've removed it and you clean it, how do you feel? Great. No burning, no nothing, right? Right. No, it's pleasant. Just let me mention one important thing, and that is when we started with the Biophyto series, we started off with the gel which was thicker, and that had a little bit of a problem with it, and it was changed, and it's now fantastic. Much more liquidy, much more fluid, much softer. It actually happened right after the first time. We changed it immediately. So if you had, like you said, a less pleasant experience, it has changed. It's not the same product anymore. So why don't you come afterwards and touch it, and you see that it's not the same product anymore. It's a fantastic product these days. So now I've cleaned it. And here again, I could use a tonic just a little bit to allow the skin to feel better. A little bit of the toner. And with the toner, again, sometimes I do it in between stages, right? Okay. There was a question, and the answer is we're going to get to that. And the patient is saying, yes, I'm feeling great, and it also smells very nice. Now, choose how to choose the right peeling. So Inbal said, well, Miriam, I have sensitive skin, not so sensitive but reactive. Women like to say, my skin is sensitive. Some skins are not sensitive, but they react faster. They become red, but the skin is not necessarily sensitive. So, so could be either way. Almost every person thinks they have sensitive skin. Now, I gave you 4A, the weakest one. Okay, right. So the first method applies here. The central area of the face will react faster and harder because with oily skin, with seborrheic skin, acne-ridden skin, the central area where the sebaceous glands are will always become redder faster. It will, of course, treat it and attack it, but that's where it will react faster. So I start with the sides and I move towards the center, and once again, it's important to note the kind of layer that you apply. With a thicker layer, the effect will be stronger. With a thinner layer, gentler layer, the effect will be weaker. So this is how you go. Think if it's the right thing to do to use the peeling on the less sensitive areas compared to the areas which you always... I mean, it's not just that it's good, it just has a faster effect. If it's seborrhea, then the skin is more exposed, and if it's the sebaceous glands working overtime, then they always respond to substances such as retinol and various other substances. So towards the end, I'm going to get to those, apply a thin layer, and I'm also going to spread it a little bit with my hand so it won't all be concentrated in one place. Okay. Now, a very small amount. Now, when it's thicker skin, sort of pitted skin, if you want to be more effective, you could take a piece of gauze
It's not a gauze. Take it and wrap it around the fingers, and you can clean it. Also activates the herbs in the Biofito. It makes them penetrate the skin, and it's very good for the flow. Dry gauze, yes. If the skin is very fine, something also more delicate. It's just like a pad, and you work on it like this, and you clean it with lac dermabrasion. If there are keratosis here, so you can treat them also and remove them. If there are squamous cells from seborrhea, you can remove them as well, because you clean it very well. How long are you going to leave the peeling on the skin? You have already removed it, haven't you? As long as I haven't washed it, there is something. The minute I wash it, it's going to be removed, because the active ingredients are liquid, and the different alpha acids are still working. So again, there is an interesting thing here. The plants that we've got here, the menthol and the anise, are like when we have an infusion of mint leaves, for example, with cold water. It's colder, and it makes things warmer, and if you use it with cold water, it makes things colder. For example, if with a hot bandage you feel warmer or hotter than before, and if you put cold water, it depends. The mint can bring about a warmer or a colder result. I do it according to the person I'm talking. I'm dealing with. I can also start with a warm bandage and then a cold one. They are talking about that today in the United States. It's part and parcel of a good blood flow that that affects the good activity of the skin. From this, I get a good oxygenation of the skin cells, and if it's sometimes difficult for me to explain how these therapeutic qualities have been found or discovered. You can't do anything without a Biofito. You know it for years. Okay, so you've got it here as well. You see here how her skin shines. Okay, I clean it. When you massage, no, sorry, talk first about the 4+. Do you see the wonderful shiny skin? When I go with this wipe ones, you see that you see how smooth it is. It's like it's as if you can hear the sound of the skin. Now, in case there's a need for it, if not, you don't have to use it, to use the corrector. But if so, I put it on an applicator or a small piece of gauze, and this is really topical in the area with seborrhea. It's not for an open wound. Don't put it on an open wound because it's going to burn too much. This is for cases in which the wound is closed, papula, fistula, whatever, cyst, or on seborrhea with an applicator, and you finish the treatment. Okay. To take a small applicator because it absorbs a lot of material. I do it topically. You know the areas of the seborrhea usually, and also these small pimples that she's got. I treat the individual problems. It's not all over the skin. And the shine and everything. It's so nice. It's so nice. I used cold water, very cold water. Now I'm going to massage her a little bit with an ice cream. Clean hands. You probably know the glass finger. I like to work them for drainage. You can put it in something cold like ice cubes. It's really nice when it's really cold. It's a very light, qualitative cream, a wonderful cream for massaging. You remember this area? This massaging cream goes with oily or fatty skin as well, because it has a B complex vitamin that balances the sebocytes. It also has cytoceramides that help balancing the activity of the sebum glands, and it reduces the appearance of comedones on a long-range basis, and it's being absorbed totally by the skin. It's not heavy stuff or something like this. It's really absorbed very well by the skin. So don't you worry if you massage an oily or fatty skin. You're not going to create any overdose. On the other way around, you're going to create a balance. But the massage should, of course, be the appropriate one, not an invigorating one. We've got this part that crosses the face. Here it gets into the brain, and if there's any inflammation, this duct really directs it towards the head, and it reaches down to the mandibula. So we are going to massage along this special line from the mandibula to the head. I promise you, we are not going to take too much time from you, but even I would like to show you something very simple that you can work with. Great, isn't it? Yes, it is. Very aesthetic. Can we buy it? Yes, we can. Right now, we don't have it in our stocks, the glass fingers and the material. The beauty globes are also not available, or you can do it like this. It looks simple, but it's so right. This massage. Now it's the turn of the mask. This is a very creative part. You should put the cream in, and if you feel that there's too much of it, you can take it out with remove some of it with a wet wipe. Now, if the if we want to absorb the or resorb the fat, we are going to go for the seb adjuster. Okay. We can combine simultaneously even 3 masks. Here a mask, there a mask around the eyes, even like a puzzle, to have a number of masks on the face. If you're really, really creative, you can have even 2 masks. Let's say that there are big pores in the skin, but also with redness. You can first of all put the sebo protector and then the anti-rouge. Or, well, we've got the Zatar that can be used topically if needed for seborrhea or all over the face, and you can really combine it. So I said that it's tailor-made individually for the needs of every client. You know, it's as if we divide the skin into different squares, so you can do it topically, some of them, or 2 masks, or I like to mix them. I know that people don't like too much to mix. If there's a problem of redness and pores, to take a little bit anti-rougeur and a little bit sub-objector and to use it together. We've got the revitalizing mask, which is a wonderful anti-aging mask if there's a problem of aging and unbalanced skin. Not getting older, you know, not aging. Just to be shiny and glamorous. It's if the pores are open, and I first of all take this seb objector to and then I put a revitalizer because we want the patients, the clients, to feel nice, and they go out the clinic feeling wonderfully. Miriam uses number 9, the eye cream, as an eye mask as well. So sorry, I can't hear people without a mic. This here we are talking about a concept of the designated or dedicated materials. All our products are good. Here again, I can put it on the neck as well. And which one would you like to apply? What would you like to start with? I would have taken the seb adjuster and worked with it in the middle in a T form, and in the revitalizing I would work as well. I don't need the Zatar, I don't need the Rouge Aid. So this is the sebo adjuster. Take it, a little bit of it. Not a very thick layer. You can use a thin layer. Just see if it's enough for you. Sorry, can't hear the question. Just a minute. Is it enough? Okay. We're working fast. Maybe it's not elegant as it usually is, but maybe we will have enough time to see some other things as well. In the sub-adjuster, we have bioestrogen complex. It's a special complex that in fact works on the reduction of the appearance of the sebum, a good resorption of a sebum from the deeper layers of the skin. It works with biosulfur, and the biosulfur is a fantastic material in terms of the treatment of the sebum and the bad odor that it creates, and it's antimicrobial, as the dermatologist has already mentioned. It's very important, and we've got here the chlorophonium as well. All of them work on a more balanced sebum activity. The reduction of comedones within 3 weeks, we can expect a decrease of around 70% in the appearance of comedones. And it's like a puzzle. You can do it like a puzzle, really, in a very individual way, a tailor-made way, or just put one mask. You can play with it in the peelings that is stronger and less strong, and also here as well in the strong and the weaker one. The layer is what makes the difference, and the time. The treatment is such that you can maneuver, and actually, like I've said, there is, I don't know many, I don't know many intoxication victims, women who smoke, and different situations of the skin that we want to change. Every skin has to have good metabolism, has to breathe. And I remember when I launched BioFit, people wanted to kill me. Christina, it's so powerful, it's so strong. And I knew that I needed something that would show activity on the skin. I would like to feel the blood flow. I want the client to tell me that she feels something, and people started to understand that yes, active materials make you feel good. And when I started to ask people, and it's really, it's the truth, how do you feel with the peeling or after the peeling? So the question was as follows: I don't know, Christina, it just works. And then later on, we took it as a slogan, Christina, it just works. And it started with the BioFeto. People, when I ask them, how do you feel? I feel wonderful. So explain it to me. They said to me, no, it just works. Today, women can explain that it constricts and or contracts and does this or that, and that's how the name or the slogan started. And remember, we were once in Hong Kong in a certain conference, and was approached by somebody, and he said, Christina, it just works. And I said to myself, how did we explain ourselves so well? People didn't know how to explain it. And I remember hearing somebody somewhere and hearing two people that were speaking to each other. One said to the other, I've got that beautician that bought this burning material, but I can tell you that it's wonderful for seborrhea in the head. Before I transplant hair, I clean the scalp with this material. And the other one said to him, but if you have gray hair, it might dye the hair. And plants really color things, like tea, for example. Tea also colors things, but your skin is going to be wonderful. So I asked him, is it BioFeto? And he said me yes. And then we started to speak about BioFeto, and I understand that this and the hyaluronic acid, these two materials were at the golden key of Christina to get into the world in Israel and abroad. I went to the United States and there was a whole group. Listen, do you have some of this substance of biophyto? You know, the Israelis that were there. So these are really nice stories. Maybe once she is waiting, we will have the pictures, the before and after pictures. Is the computer okay now? So we'll see the pictures.
Ah, such beautiful white. Look how white we are. Okay, we need Miriam's presentation with the pictures. I want to show you a few pictures. I'll show you what was written here, but they're all pictures from our marketers who sent us pictures so that we see their results. Okay? So, are you familiar with this, Oli? This is mine. Look at this beautiful result. This is just a few words. Can you say just a few words about this? Yeah. Here we see. They have to see it. Okay, so the patient came to me with many comedones, both open and closed, papules, pustules. It's the same one, you know, with those purple pimples that stay there for so long and never go away. She had those as well. And after giving her Comodex for home treatment, in this case it's pure Comodex, I directed her in such a way that when she uses it at home, especially the night treatment, which includes the retinol and the acid, salicylic acid, has a fantastic impact on oily skin. The salicylic acid as well. The thing is that if she uses like one the amount of 1 pea or 2 peas, it will have the same impact. And this is something that you have to explain how much to use. Now, after a few months, not 1 month, after a few months, because this is very, very oily skin, and there are ups and downs when it comes to acne as well. It's not like this optimal situation that you see here just stays the same. She broke up with her boyfriend. She went abroad and then came back. She was flying around the world. She didn't do any treatment, then came back looking like this again, and we stabilize it again, and it keeps coming back. But you know that you have fantastic tools that you can use and get results. The other tool that allowed me and helped me to get this very fine polish of the skin when the skin was finally healed was the Rose de Mer, of course, but that's when the skin was healthy already, and I could use the Rose de Mer for peeling, not for healing, because Rose de Mer can be introduced at any point in the process, but I used it at the end of the process in order to make the skin smooth and clean off all the marks, all the post-inflammation that we had before very nicely. So there. Here we have some more. Now look. This is a woman of over 40. She has a later age acne. I'm sorry, we cannot hear Miriam so well. We'll try again. Very oily skin. And sometimes people say, well, Comodex is for younger girls. No, sometimes when there's oily skin, you can use it. This woman is from Mexico, where it's hot and humid, and have fatty nutrition, a lot of stress. So you can see the results again. Comodex, Rose-de-Mer, fluoroxygen. You play around with the skin according to the condition. Use all the options. Just let us continue and see some more results. This is a lady from Korea, South Korea. And you see, we talked about ethnic groups, the area that you're in, right? So there's very high humidity in the summer, it's hot. And on the other hand, in winter, it's cold, even -10, -20. So the difference in weather, fatty nutrition, very oily skin. So yeah, let's move on. Next one. So can you see what's going on here? It's not really acne, but she has this and joy, oily skin, and this is the same girl. And can you see at the end such nice results? They sent this to us. They do the treatment, and in Korea, the marketing company that we have markets us in doctors' clinics, and those are buildings like 20 stories or even more, and it's very prestigious to get into such a place. It's really doctors' clinics, and through Korea we got to Japan as well, because once we got a reputation, then now we are in Japan as well, and I've been there already and demonstrated, and we're really there. So just see what the skin looks like now. She's not embarrassed anymore, and she's willing to have her full face in the picture. The first photo she wouldn't have taken. So you see, it's not a very big problem, but it's annoying, and the person is unhappy, and you don't get any results, and it's static. So it's not always a matter of the severity of the situation. Let's move on. Hold on. Okay. That's the guy from Korea. Hold on. So this fellow here, this is Rose-de-Mer, only once, but very strong. And then giving them, well, when I was giving instruction in there, he was our interpreter, and they said, why don't you give him some, why don't you do peeling on him? And I said, no, I'm not going to risk it, but I still did. I don't know, somehow I got the courage for it, and I told him that he must use the kit that I gave him to use at home, and those were the results. I must say that these results, the girl from Japan said, I want you. We were about to close a deal with someone else, but I fell in love with this girl. She was pretty and clever, and she had about 200 beauty salons already, so we decided that we're going to work with her. Somehow we managed to wriggle out of the first deal and went with her, and he was our case. Because now, why am I telling you this? Because you as well, when you find a client who gets results that brings you other customers, I don't really believe in advertising. I believe that when in results, when someone gets the results and brings you someone else, and there's nothing better than results you can see. And I think that when a person sees results, they keep buying products and they come back. There's no other way. If you're happy, they buy your products and they come back with other patients as well. So Let's continue. Here again you see papules and all these annoying pimples, and once again fantastic results. I don't even remember where this picture is from. Next one. This is from Russia, you can tell. This irritated area. It could be cuperose, could be rosacea even, could be sensitivity, but you see, this all comes from that doctor. At some point I'm going to bring her to Israel. She's a fantastic doctor, and she was working with the Comodex, and there was this these results, very beautiful results that I'm very pleased with. Now, you don't always have to show pictures which look like someone been, I don't know where, been through hell. It's look at this girl, a very nice looking girl, and it's not a skin that says, "Oh, heaven help me," but it's still annoying. And these are the results that she had after 2 or 3 months. It wasn't like magic. She worked hard on it. I gave her Comodex to take home, and she worked with it, and you can see the results here and here and here and here. Do you see? This side, the left hand side, is before, and the right hand side is after. You can tell the results, right? It's not a revolution, but sometimes this can be more annoying because she won't take antibiotics. She doesn't need Roaccutane. So what do? Look at this case. Again, not a case where you can see some revolution here, but you can still tell there are some results. Yes, there are some scars, but the skin does look a little bit smoother, and that's after one treatment with Rose de Mer. This is right and left. The right is after. Okay, your pictures. Again, here not very dramatic, but yes, there are some results. This is the up and down, up and down. Above is the before, below is the after, and all kinds of cases. Folliculitis, pustules, seborrhea, all kinds of sensitivities, and you see that the skin just looks better. He didn't shave because apparently he was the skin was too irritated for that. Again, this is a case of a woman who's almost 60, and she says it started when she became menopausal, and she said she never had it before. I don't know, it's very oily skin, but you can tell the results because she uses the Biophyto and the Zartal because you don't want to dry the skin. You see that the skin, well, I think the basis is very oily and must have had acne when she was younger, and then continued here. But you can see the results improved her skin, and at this sort of age, she's not going to take antibiotics or Roaccutane. I'm very pleased with these results, particularly in this age. So, you see, just look at those examples. All kinds of little pimples, annoying little things. You can see that the skin is not smooth, and the skin becomes better and better. Not in one fell swoop, not a revolution, but still getting better. And I think you can see it here. Can you see the change? Can you see the difference? Here again, you can see from here to here, from here to here, you see the difference. I think this is the difference after one treatment, 1 or 2. And don't forget, most Russian girls have a good skin, so it wouldn't do wouldn't have there wouldn't be like a big revolution here, but there are still good results. Okay, let us give you a mirror now, see your face. I'm feeling great. Could you sit up, please? I'm having a great time. I'm having a great time. You feel good, right? Yeah. It's a kind of treatment that makes you feel really great. And my face looks nice, yes. Okay. I think only this is one of your cases, right? Yeah, yes, this is one of my cases. Look, this is not an easy one. One of the very special cases where I actually had to go and convince her to go and take Roaccutane, and she wouldn't, and I didn't think that I would be able to do anything with this. I really talked to her and tried to get her to do it, and apparently she had previous trauma, and she was worried about her liver because she had trauma to the liver as well, so she wouldn't. And let's see the results now. You see, this is still not the end, and you can still see, by the way, it took a whole year, not just some sort of magic wand here. Every month another treatment until we finally got there. There's still some activity around the mouth, but later on you'll see that it's becoming clear and clean. Still in the middle, still some activity, but all the other areas. And look at the neck, how the neck is already clean, completely clean. Still some activity around the mouth. See, after Ros de Mer, of course. No Roaccutane. At the end, I did Ros de Mer once. Comodex, one of the cases that I used Comodex on, and occasionally I gave her some to take home, because the Comodex for the night, when you use it every night, it might create some exfoliation, and the Zata was very good, and the Ros de Mer peeling soap was very good for her. All the acne materials, Comodex materials, I often used to add some serum. I'm sorry, no, Comodex, the serum that you used in the morning, okay? You don't pay attention enough. I can see that you don't purchase it so much, but it's a very good serum, and it has anti-inflammatory agents in it and soothing agents in it, so it gives plenty of fluids to the skin, which helps it heal and helps it recover. And the more hydration you give to the skin is important, because you have to help the skin to rehabilitate itself. Without the water, the cells can't thrive, and the skin can't repair itself. So you need more of that, and you see the skin. The girl has now got the skin that she deserves. A few more cases. Now this is an interesting case. She's not here. Okay, she's left. She just allowed me to say it. This lady has diabetes, juvenile diabetes, and Dr. Yorav said that people with diabetes could suffer from this problem of having a skin which is hyperreactive to acne, and there are many things that you can't do. And he was just being treated with Ros de Mer. Look at the difference between the first picture and the last one. You can see that obviously it doesn't last forever. These results, you have to continue treating at home and repeat the treatment, but you can see what you can achieve. This girl has been she was here, and she allowed us to use this picture, and you can see that it's a lot better than you can see in the top ones. But here as well, the Ros de Mer, the new peeling. Let me give you a piece of advice now. pregnant women, or when women stop taking contraceptive pills and they get these pimples here, there's not much you can do, especially if they're pregnant. But Rose de Mer gives excellent results, and it's very easy. The soap and the new one that we are now working on, and the classic Rose de Mer, but that's on thicker skin. Now that we're going to have the marine, you will be able to obtain very good results. So, are we done? And microphone, please. Okay, so often as you can see, we don't revolutionize the situation, but we do get nice results. We take care of our patients. You saw Asi here, that we use the Comodex on, no Photoshop. And you saw that the lady who just finished here, and she said, I feel wonderful and it's refreshing. Look, I do believe in cosmetics. I believe we have a lot to offer. I believe in those preparations that we have, and I believe that we can. Yes, and if we follow up, then yes, you must. 50% at home, even more.
Into the mic, please. It's like it's like being treated by a dental hygienist. שלחתי כבר שאלה לשולה בנידון. כן, שזה נראה שהם לא מתקרבים לסיום, וזה כבר ממש. What I would like to say is that I'm shooting a lot of injections workshop of hyaluronic acids, injections against wrinkles and Botox, etc. In some situations, a woman or a man 60, 65 years old, they come and they are being analyzed and diagnosed, and you have to decide what to do for them to fill the labial part or the cheeks. But there are situations in which women come with a situation in which the skin is problematic, lots of small wrinkles, and you can't solve the problem by injections. So you can't do anything. Aesthetic medicine can't treat such a that is generally in very low situation, and you can't do anything for it. Sorry, I can't hear her. She's not speaking into the mic. Into the mic, please. It was a day. First of all, thank you for having arrived. It was a very enjoyable day, a fruitful day, and I hope that you have felt this good dynamics, nice treatments, very good lectures. We're going to keep on with this tradition. It adds a lot to us and to you, I'm sure, and to all those that participated in our activities abroad. We would like to thank you, and we feel this connection with you. We could share the know-how with you abroad. Thank you all very much.